Thank you.
Okay, all technical matters done.
Hi, everyone.
Hello, hello. Great. Well, thank you all for being here today. As our listeners know, today we'll be discussing. Okay, sorry. My name is Wintana Bairu, and I'll be co-moderating today's panel discussion on when COVID-19 hits home, a conversation on how to navigate the healthcare system. Today joining us is Dr. Adiam Tsegay, who's going to share a bit about her personal experience with COVID-19, and our reoccurring panelists, Dr. Hanna and Dr. Shoei. So without further ado, I'd like to invite Dr. Adiam, who will also be my co-moderator today and our first speaker, to share with us her personal experience with COVID-19. Thank you, Dr. Adiam.
Sure. Thank you so much. Thank you so much, Winter, for moderating with me on this critical conversation today. Let me start out with thanking Dr. Menges and team for creating this important platform to inform and empower our community, both in the US and across the globe. I would also like to take to thank my family and our medical advocates, doctors, and friends for their incredible support and guides. As you know, COVID-19 has ravaged the state of not only our own physical and mental health, as well as our social and economic state of being. But most importantly, and heartbreakingly, it has taken away loved ones unexpectedly across the globe. According to the data, the impact of COVID-19 impact has hit people of color across the US, particularly the hardest. Sadly, it has become more of a reality that a lot of us have been or know someone within our community who is directly or indirectly affected by this horrible virus at a higher rate. Tragically, I'm sorry, it has personally affected me and my family, where we lost our beloved mother in May to COVID-19. Today, I would like to take this opportunity to speak briefly on the horrible experience and lesson that my family and I had in advocating for our beloved mother within the US hospital system. I'll be using I and we interchangeably, as it was my entire family advocating for our mother. To put it in context, our mother had never been hospitalized before, so we had to quickly learn how to advocate and navigate on her behalf. In reflecting on the experience over a 2 to 3 month time span of our mother's hospitalization with COVID, it was one of the most difficult, trying times that we ever had experienced in our lives. We were sick with grief that we could not see our mother nor advocate for her in person. I tell you, it was probably one of the most challenging. I know the virus was very difficult, but I think probably the most challenging for all of us was to not be by her bedside during this difficult time. Equally, just imagine having to deal with over 10 plus doctors, 15 nurses and plus, 6 plus hospital staff, mostly through phone calls and Zoom. It was very overwhelming and challenging, to say the least. However, we were determined that we were going to be her voice and ensure that our mother received the best quality of care that she deserved. It became very real that the medical community had a lot of uncertainty surrounding the virus and its effect, as you all know. To this end, not only did we have to educate ourselves about how to navigate the inner workings of the hospital. As I said, we would never, our family was never in that situation prior to this, but we also had to learn about the virus and treatment options and any reports that were coming out with respect to COVID-19. In order to effectively advocate for our mother, we had to request to get access to our mother's medical record on a daily basis. In doing so, it was powerful and empowering. It allowed for us to recognize that our mother was not receiving all possible form of intervention, therapeutic trial treatments that the hospital was offering or providing. Also, by having her medical record, it allowed us to ask detailed questions regarding her prognosis and progress. It was also important that we made sure we had a daily update from the doctors and the nurses. I tell you, these calls, particularly with the doctors, usually lasted 30 to 45 minutes. And I tell you, those doctors knew early on that we were going to be this type of family, that we were going to ask questions, and we were going to do follow-up with those questions to ensure that we were on top of everything that was happening with our mother. So they knew and anticipated. As a matter of fact, there was this joke that all the doctors would sometimes relate to us in saying that we know that we had to prepare and get our document information together. Remember, we were dealing with 10 and plus doctors, so almost every 2 other days, it was a different doctor that we were dealing with. And what we found was very important was to keep a journal. I have 2 journals that sequence the event that we discussed on. And this was really critical because, as you could imagine, it was a very stressful time. And so it was very helpful to have the journal to be able to refer back to. This gave us, but more importantly, I want to stress, this gave us the opportunity to respectfully challenge and question the treatment plan that was being used on our mother, which I think is a very key to empower individuals. At times, we find ourselves formally and in writing requesting treatment that were not being offered. It is important to note that we were not just advocating for the treatment, but for the treatment to be given in a timely manner. And at the time, the research was suggesting that time was of essence in terms of how these treatments were having an effect or not on individuals with COVID. But I have to tell you, this was not done in isolation. We reached out to medical advocacy network, families, and friends to help, to inform, and at times participate on calls with us. This was a time to rely on our community, and it was humbling to know that these individuals spent countless hours assisting us at every level. And I think this is where I think at times we get our pride get in the way, but this is not the time for that. This is the time to rely on each other. I am very certain that we know people in the medical field. We know people that could help us to advocate. So reaching out is probably one of the most important things that we did. Another important aspect of our experience was understanding the role of the non-medical staff, social workers, patient relations, the spiritual care factored into the medical team. These services and individuals were key, not only providing information to our family, but also serving as a connection between us and the doctor. They were instrumental at times in facilitating a team meeting with doctors, both in person and virtual. As part of the medical team, these individuals documented our concerns and our wishes. And I can't emphasize enough that these individuals or services are part of the hospital intent to ensure that patient voice and wishes are heard. And it's important to know that these individuals, and particularly in the COVID era, as you know, it was difficult for us or anybody to go into the hospital, but these individuals were allowed to be in the hospital, so they were there at times with our mother when we couldn't be. So it was important to know these individuals. Another important part of our advocacy was also to understand and learn the hospital policy, particularly as it relates to COVID, because there were an ongoing changes relating to therapeutic trial drugs, visiting policies, both virtual and in person. As a result of learning and understanding the policy, and it was all on the website, so it's not something that's hidden somewhere, so any of us have access to that of any hospital. as a result of that, we were able to advocate with limited in-person visit and schedule regular virtual visit with our mom. It was at times twice a day or 3 times a day where we were able to visit with our mom through virtual. We adapted. We were able to play her favorite music. We
Thank you, Dr. Adiam.
Lastly, it was always essential to remind the medical staff that our mother was not just defined by COVID, and to focus on her as a person. It was at the beginning that I constantly we heard that it was the COVID patient. It was the COVID patient. We insisted that they refer to our mother by her name. And I have to be honest and tell you that each changed our dialogue with the physicians and the nurses, because now they had somebody by name, a mother, and they were able to define her differently and talk about her much differently. What I could tell you with confidence that all the medical personnel that encountered with our mother knew who she was. I could tell you when I called the front desk, the front receptionist knew who I was and who I needed to speak with without even me asking for her and for the unit. So it was powerful to know that from the receptionist all the way to the chief medical officer of the hospital knew our mom and understood her health condition and all the things that we were doing to advocate for her, because we were the one that was going to advocate for her because we knew her the best. And so I know this was a little bit emotional, but as you can imagine, it was our mother, beloved mother. And I thank you for giving me this opportunity to share briefly our experience with our mother and with the hospital. Thank you.
Thank you, Dr. Adiam. Truly, thank you. I know this must be very difficult to speak about, but our gratitude towards you for humanizing what's going on and the steps, truly sharing the importance of pushing for the well-being of your family members. This in itself is an emotional topic. It hasn't hit all of us, but we do have to understand that when it comes, all we can do is be prepared as much as we can and do our best. So thank you for sharing what you went through.
Thank you.
At this time, I'd like to move over to Dr. Hanna to give us some insight on outpatient standard rights for COVID-19. Thank you, Dr. Hanna, for being here today. So let's just start with what does it mean for your family member that has COVID-19 that has to stay home?
So first of all, I just want to say thank you to Adiam. And one thing that I would like is that Adiam was persistent and tenacious in advocating for her mother. I wish every parent that is hospitalized has that kind of advocacy. And it was night and day for over 5-6 weeks nonstop. And that was, she did everything she can. And I think, Adiam, we cannot fight what is, what things that we cannot control. But I just want to let you know that you did the best that you can to get your mother what she needed. And I have never seen that before. And, at the end of the day, the outcome was different, but I think you should be really, proud of yourself, how you advocated for her. And I want you to be the messenger for everybody that has a parent or a family member, because the hospital system is not an easy to navigate. There's roadblocks everywhere, as you remember. And, but you went through those roadblocks and you were there. As you said, you made your mom not just a COVID patient, but by her name, they identified her. And so I just want to say thank you.
Welcome. Thank you.
Right. And in terms of outpatient, for instance, there are two kinds of patients, right? So there could be many kinds of patients for COVID. The ones that are asymptomatic, the ones that have very, very minimal symptom. Maybe they had a little fever or a cough and that was it. 2 days and 3 days lasted. And some that were sick, but not sick enough to be hospitalized. Okay, so we're talking about the ones that are sick, that not sick enough to be hospitalized. And these are people, the symptoms is not easy. They have difficulty breathing, they have cough, okay? They may not have the oxygen level that is, risky for their life, that they need hospitalization, but they have persistent cough, they have body aches, some people may have diarrhea. But we're told you're not sick enough. I mean, even if you go to an emergency room and these were just minimal symptoms and they send you home, you're fine, just, weather it out at home, And so what does that mean? That means then that person has to drink appropriately, eat appropriately. If the body aches are bad, they may have to take, Tylenol or some sort of pain control to go on through the duration. And what does that mean to the family? The family means that if somebody is sick, then you would have to quarantine them, right? And unfortunately, a lot of the our communities and any other immigrant communities and Black and brown communities, we don't have the luxury of having so many rooms to really, isolate our parents or whoever is sick. And in my instances, for patients that I have, most of my patients were Hispanics and multi-generational families living together. Grandparents are there, aunts and uncles are there, most of them immigrants, and they may have 3 rooms and a living room and one bathroom only. So when I tell them, okay, now you need to really isolate yourself, they're like, okay, I'm gonna lock myself in the room, and then maybe where's the other family gonna be at? So it's just so difficult to isolate. And therefore this diseases became rampant in these communities because there's no physical or any way that you could do to follow what the CDC guidelines are. The rich people could go somewhere, isolate themselves somewhere else, or if people of means can isolate themselves, and people do very well with that. And so what we do when a patient is identified as COVID patient, but not sick enough to be hospitalized, then in our clinic, what we determined was we just can't just tell them to go home and you'll get better. Or if you get worse, just go to emergency room. We had to have a system put in to where we check on them. First, we triage them. Triage mean, okay, how sick is he? Do I have to call him every day, or somebody has to call him every day, or is it every 2 days or every 3 days? And this would be either nurses, trained nurses, or physicians calling to check on these patients. If the symptoms are worse, then we would guide them to go to emergency room, or sometimes at times we have sent ambulance to the homes. And so we have to make sure that they have adequate food, that we have to, in some instances, some community organizations were providing food services because these people are not working, they're just isolated, all the families in home, nobody is working, and most of them have no means of getting extra money. And so food banks and other agencies were dropping food for the family. And so, or family members, extended family members in the community would drop in food at the door and leave. And sometimes even if you are quarantining somebody in the home, that's what you did. Isolate their plates and forks and knives and just leave it at the door, and people would just take their food and then put it back. The same thing we had in our community. We had to say, those that are sick or those that are old, we told them not to go anywhere. Please check on them, deliver groceries if it is necessary. And so it's not just that patient, it's the whole family that is affected in terms of an outpatient. And so you really need to have a system that works to support that family that is dealing with COVID, not just that patient. So our experience has been, it depends from which part of the country, what kind of services available in the area, what insurance they have. For us, I'm in Boston area, and we have amazing other community services that we're really, coming through for most of our patients.
So what steps should be taken if it turns out that the outpatient needs to go to the hospital?
So what we do basically is, and as I said, when we send them some patients that have respiratory problems, most patients go with pulse oximetry, which is basically a small instrument that would check the how much percentage of oxygen percentage that person getting in. And so based on that, then we could say, we either have to send them by ambulance or they would have to go to emergency room. And if they're going to emergency room, we alert the emergency room that the patient is coming in. And so really the care team has to be part of the transition from home to emergency room.
Mm-hmm.
And we don't tell people to go by, taxi or whatever it is. Even if it's by ambulance, then we tell them it is a COVID patient. So they would have, of course, the appropriate PPEs to transfer that patient.
Thank you. You just answered my follow-up question. So how should a patient's primary doctor be involved?
I think the primary care doctor should be involved from the get-go. Okay. Initially, we did not know. It was just things were happening dramatically, and my primary care doctors do not know what to do with the COVID patient, and that's why we said, okay, you got to go to the hospital. But as time goes by, now we have more information on what we need to do and what to expect when a patient is sick. So the primary care, the day that the patient is in a hospital, they need to follow, because information flows to the primary care, and also at the time of discharge. For us, where I work, the hospital notifies the primary care that the patient is being discharged. They discharge with home health services or nursing home, visiting nurses, or they also say, you have to go see your primary care doctor within a day or two. And so when the person is discharged home, already the next day, a call calls out from the nurse or whoever. We have, as I said, the COVID follow-up COVID patient follow-up that we do. And based on that, we have to follow up, because these patients that are discharged home, they could be after a prolonged hospitalization. They could be on many, many medications, such as, anti-clotting medications, where patients had clots in their lungs, and they really need to have those medications on a daily basis. So somebody has to manage those. Otherwise, patients may not be really in tune into taking it daily, and a dire consequence. People could have, clot forming, and therefore a clot in their lungs, and die. And we actually had an incident where a patient was not taking the medicine and died of, from the clot reoccurring. And so it's very, very important to involve the primary care doctor, and also the family has to be educated of what medications the patient is taking and what they need to take.
And let's say in the scenario we're working with, how do you ensure that all health professionals that are involved in the care for your family member have the necessary and important health information?
I think it starts with the primary care. And I know that we think it's, medical doctors are for old people, especially when it comes into the eye of the young people. They look at, they have insurance, but they don't really have a primary care. I mean, I have family members that are in their, early 30s or whatever. They feel healthy. Why do I need a doctor? But you're paying insurance, right? And so the primary care doctor needs to know the history. They need to know what's going on with you. And then therefore, when something happens, they would give all this information to the caring hospital. And especially that is so important when the person cannot really explain or is not able to converse. And sometimes patients, families don't really know what the medications are, what disease are. Oh, I don't know, he takes many medications, or she takes medication. I don't know, the doctor or the nurse comes and give it to her. I think it is upon us to really know what our family's illnesses are, especially the people that we live in, what medications they're taking, because that's what they say when they come to emergency. What medications are they? What is their problem? Because that will give them like 75% of the causes why a patient is there. And so it is very important that a primary care has to be involved, and that would be the, providing all the lead to the hospitals.
Thank you, Dr. Hanna. Dr. Adiam?
Thank you so much. Thank you, Dr. Hannah. That was very helpful. As you also, just to kind of add to that, I think you know that a lot of our and especially in our community, they're going through this in home and knowing what to do and what to ask. That's also equally empowering. Let me welcome Dr. Shoei for joining us this today. I know in some places it's afternoon, in some places it's early morning. So thank you, Dr. Shoei, for joining us. And so can we talk a little bit about the inpatient as it relates to when our family members are hospitalized? What does that mean?
Okay. Well, thank you for having me, Wintana. And Adam, thank you so much for initiating this important topic. And I want to start by saying that I'm so sorry for your loss. And also, I really do admire you for choosing to change this tragic loss of your loved one and choose to educate and inform and share all this information with people so that if anyone, God forbid, has to go through such hardship, they will be able to know how to navigate through the healthcare system.
Absolutely.
And I appreciate you for that, and my hat goes off to you.
Thank you.
Let me start with the basics.
Sure.
You know, for a family member or for a patient to even ask a question or understand the right, we need to know the basics, meaning that, let's say a person feels sick and wants to seek medical advice. Obviously, he or she will contact a healthcare professional, and the healthcare professional will agree to see the patient and evaluate the person. Right at that point, a doctor-patient relationship is already established. So this relationship is, for the most part, defined, it's a consensual relationship in which the patient knowingly seeks doctor's assistance and the physician knowingly accepts the patient or the person as a patient. And there really has to be a collaborative effort between patient and physician in a very mutually respectful way, like you really have showed us when you went through that process. And this relationship then comes with its own obligations, its own rights. Okay, so patients have to know what their rights are as a patient once they form this patient-doctor relationship. The first is that a patient has a right to receive information from healthcare professional and have the opportunity to ask questions, discuss risk of a procedure, benefit of a procedure that's planned, and a treatment that's planned, and the alternative to such treatment as well, including cost of treatment. That's why we sign consent when our family members have to go through, or we have to go through any kind of procedure or surgery. For instance, if I'm told by my doctor that I need to have my appendix out because my appendix is inflamed, and I have to ask the right questions, you know, based on what testing did you come to conclude that I have a bad appendix, and what does the procedure or the surgery entail? And what should I expect my recovery to be? Or when can I get back to my daily routines? Or if I refuse the surgery or this procedure, what are the consequences? So you are not trying to intimidate the healthcare professional, but you're asking the right questions so that they can make an informed decision. The second thing is that the patient has a right to make decisions about the care the physician is recommending, and also have the right that these decisions has to be respected by the healthcare professional. So a patient who has decision-making capacity may accept and may even refuse any recommended medical intervention. It's the obligation of the medical care professional to let the patient know if you do not undergo such treatment, these are the consequences. And the medical doctor or the healthcare staff members also has to respect the patient's privacy and confidentiality. The other thing is that, and you, Adam, have seen it, that the patient has the right to obtain copies and summary of medical records, and also have a right to get a second opinion. If I'm told that I need to have certain procedure, and I feel that my questions are not answered, I'm misunderstood, or for whatever reason, and I ask a second opinion, I have a full right for that. And the one thing that we also have to know is that a patient has a right for continuity of care. I think Dr. Hanna mentioned it. if let's say I'm in a hospital getting a treatment for, say, heart failure, the team who's taking care of me in the hospital has the obligation to get me a follow-up appointment as an outpatient. And a very good point Dr. Hannah mentioned is that patients are discharged with a medication list. 2-page list of medications. Some of these medications, like blood thinner medications, need a close monitoring and follow-up and blood testing to be done. Otherwise, patients can end up with bleeding or having more clots. So the medical doctor in general has the obligation to respect the patient's autonomy, to maintain confidentiality, and also explain treatment options, and has also the obligation to provide the highest standard of care. And he or she has to commit not to abandon the patient without giving him or her, the patient, adequate time to find a new provider if a patient asks to have a new provider. So all these rights, when it comes to COVID, the same rights apply. So now let's go to, inpatient care. So when does a patient, when is it recommended for a patient to go to emergency room and need for admission? It all depends on the symptom severity. If oxygen level is getting too low, if the patient is severely short of breath and persistent fever, is becoming more confused, somnolent, and that's when he or she goes to the hospital and gets inpatient care. So when it comes to inpatient care, it gets more complex for a simple reason that obviously the disease process is more likely to be advanced, that it requires inpatient care, and also for the fact that multidisciplinary approach is implemented to take care of the patient. So when the news of this pandemic outbreak came, it changed so rapidly because it's a new disease, it's a new virus. There's so much we know, but there's a lot that we don't know as well. So, however, knowing basic facts about what can and cannot be done is really helpful to at least be a marker to ask more questions. If we're not informed, we don't even know what to ask. So the main important thing is that we have to have some sort of basic information to even ask questions. And the process of navigating through the healthcare system can really be overwhelming and in times very frustrating. And in addition, during this pandemic, it has become like a nightmare, as Adiam has mentioned, both for the patient and the families, because you can't be with the sick loved ones in the hospital, because hospitals are not allowed visitors for particularly COVID patients in an effort to contain the spread of the virus. So we need to know once our loved ones are admitted to the hospital is that we need, as a patient or as a family member, we need to get updates from the doctors and the nurses. And you have to make sure that the hospital or the care facility has the correct information on the record for the patient's #1 contact person. So just choose any family member. If there's anybody who's in a healthcare profession, that's preferable. If not, just pick one person to be kind of sort of the medical quarterback. So that person can oversee care of the loved one. Because if 5 or 6 family members are going to call and ask for information, chances are the provider is not going to call 5 or 6 is not going to make 5 or 6 calls to all to give the same information. So you assign one person, and that person can work as a liaison between the patient and the family member, between the physicians and the family members. Since many hospitals are not allowing visitors, so it's advisable for patients to bring a smartphone or tablet in order to virtually communicate with friends and family. And also the nurses and doctors can also use these devices to share updates on the progress of the health status of the sick person. And at times, I know, Adiam, you've been doing this, and it was like, it was very emotional for me even to hear that you were even having your mom listen to Tigrigna. So even those patients who are intubated and cannot speak, the nurses will hold the phone near the patient's ear so they can hear their loved ones' voices. So it's also important to take notes of the working diagnosis of the procedure recommended, the treatment plans in a very organized way so that you can address if treatment plan changed the next day, you can go back and refer to your notes and say, hey, this is what the line of treatment was and what was the reason that it was changed. And you need to make a note of who you talk to, particularly if a patient is in an ICU setting. There are multiple physicians taking care of the patient. There is an intensivist. There are consultants such as cardiologists, nephrologists, infectious disease. So it's really important to take note and also ask for clarification of any diagnosis or treatment plan that are not clear enough for you. There are also resources in the hospital. Ask for staff liaison or spiritual support. You can ask for patient advocate. And to me, patient advocate really plays a huge role in forming the connection between patient's family and the physicians. A physician might say, I'm going to call you at 11 o'clock and update you, and you might not get a call until 3 p.m. But in between, you cannot even get hold of the provider, but it's much easier to get hold of the patient advocate. Patient advocates are basically healthcare professionals. Yes, they are hired by the hospital, but they look out for the interests of the patient as well. And they also provide patients with a list of resources available in the hospital and outside the hospital. They give you so much emotional support. If you want copies of medical reports, you can get through them. You also have to know whether the hospital has a website to see if there's any procedural policy regarding, in the situation, COVID treatment, so that it can say, hey, you know, your procedure says that these patients will get this such treatment, but my loved one hasn't got it, and what is the reason? So the more information we get from different sources, the more we are able to be a strong advocate for our family members.
Absolutely. And I think just to add to that, Dr. Shoei, I think once you do that, I think the physician and the hospital staff appreciate that you did the work as well, and that you did your homework so that they're willing to answer those questions and have a very in-depth dialogue. Let's talk a little bit about advocacy care directive in terms of what that means, because a lot of times, and particularly with COVID, once our loved ones are in, especially when they're in the breathing tube and those sorts of things, they're not able to voice or make those type of decision or articulate what they think, what they want things to happen. So what does that mean when we say family advocate or someone advocating on your behalf?
Well, we're talking about family advocate or power of attorney or proxy, right?
Yes.
So let's start talking about what's advance directives to start with. So an advance directive, it's kind of a written statement. It's a legal statement of a person's wishes regarding medical treatment, and often includes a living will, which spells out medical treatments that an individual wishes to have in case a time comes where the patient loses the ability to communicate. So it literally has two parts. The first part is the proxy directive, which is called the durable power, medical power of attorney. And in some places they call it healthcare proxy, healthcare surrogate, healthcare representative, but let's address it as power of attorney. And the second part of this advanced directive is the giving instruction part of it, which is called the living will. So the power of attorney is someone that you appoint. It could be anybody's spouse, or it could be a child or a relative or friend, someone that you appoint to make medical decision for you in a situation where you become unconscious or medically sick that you cannot make sound decision, or you are at the end of life. So what you're trying to say is that if the time comes where I cannot make decision for myself, this person will take care of it, will make decision for me. The second part is the living will. The living will is basically the instruction that you give. The instruction that you give what you want to be done if you lose the ability to make a decision. So I'll give you a scenario. So for instance, if I'm in a situation, this is what I can put in as an instruction in a living will. If I'm in a situation where I have Alzheimer's, severe Alzheimer's, living in a nursing home, and people have to feed me, to dress me, to wash me, and I'm not able to do, I get to a point where I'm not able to recognize my family members. And at that point, if my heart stops, or if I stop breathing, let me go, do not resuscitate me. So this is one instruction. So the proxy or the power of attorney will know what to do if you are in that situation. Or you can even add saying that, or if I bleed profusely with severe Alzheimer's in a nursing home in this situation, don't give me blood, don't transfuse me. Let me go die, let me die naturally. Or there's a different instruction also you can give that, let's say, if I happen to have an acute illness, such as some sort of viral pneumonia, that I require to be intubated and put on a breathing machine and get a ventilatory support, I would want to get everything done if this measure is likely to be temporary. If I make it fine, if I don't, and I'm going to end up being in a vegetative state, then do not resuscitate me. So you can give different kind of instructions based on cultural beliefs, religious values, and social values. So what you want to do is you want to do both power of attorney and a living will. A power of attorney who has instructions to do what you want him or her to do. What you do not want to do is you name a proxy and you don't discuss instructions or wishes of a living will. And when the time comes, the proxy has no idea what your wishes are. So by having this both, it takes the family off the hook. You know, the fact is that if nobody knows what your wishes are, one child can say, I want this. Another child can say, nope, I want something else to be done. And such situation cause a lot of argument and can divide the family and really leave so much, lasting guilt and bitterness. So advance directive is not only for older people. Unexpected end of life situation can happen at any age. So it's important for all adults to prepare these documents. We might be healthy. We might be someone who don't have any, chronic medical illness, but anything can happen in life. So we have to be ready with it. So what it means is that by planning ahead, you can get the medical care you want, number one, and you're avoiding unnecessary suffering and relieve your caregiver from the decision-making burden during the moment of crisis. So I don't know if you want me to also, code status is also attached to this. I'm sure you were asked to give them what's the code status of your mother, right? So a code status is, there are different kind of code status, meaning that if you want your loved ones to be resuscitated, full code means do everything to bring me back. DNR, or do not resuscitate, means if my heart stops, don't do anything. And there's another condition called do not intubate, means that you can do chest compression, you can give me medications, but don't put me on a breathing machine. But I think let me talk about the full code first. So if I happen to go to the emergency room with a massive heart attack and cardiac arrest, the first thing that the emergency room doctor is going to assume is I'm a full code. So the emergency room physician is going to do everything possible to bring me back. At that time, there is no time to say, what's the code status of this person? Does it have a living will? Living will can be like 15 to 20 pages. Who's going to sort out through that to decide? So at that point, it's assumed that that particular patient is a full code. So, and especially if there's not a DNR ordered in a chart, immediately it's assumed it's a full code. So resuscitation protocol is immediately started. And we really have to be very informed about, what's resuscitation method? What's CPR? It's not like in the movies where we see CPR done, which seems to be painless and really effective, and the actor immediately instantly comes back to life. In reality, only 15% of resuscitated patients leave the hospital alive, and only 5 to 10% of them survive less than a year. So when we talk about full code, it has 3 components. Number 1, there's a CPR component of it where you compress the chest deep and hard to reach the heart, apply electrical shock to get the heart back to rhythm, and give supporting medications. The second part is the intubation part. Insert a tube into the airway and attach it to a ventilator so that oxygen can be delivered into the body. And the third part is giving different medications called vasopressors to get the patient out of shock state. So the second part is the DNR, as I said, do not resuscitate, meaning don't do CPR, don't do intubation, don't give me medications to get me out of the shock state, leave me alone. But I want to emphasize that DNR, do not resuscitate, does not mean do not treat. I can have a DNR order, and if my leg is broken, I will get treatment. My leg should be fixed, right? If I go to the emergency room for pneumonia, one of the thousands of questions that you get asked is, what's your code status? Regardless of my code status, my pneumonia is going to be treated. So do not resuscitate does not mean do not treat. It just means that if my heart stops, don't do anything. There's this other, and then, by the way, DNR order is a medical order that's written by the doctor on the medical chart that instructs the healthcare provider not to do cardiopulmonary resuscitation. The third one is do not intubate. So if you want to be do not intubate, then chest compression and cardiac medications can be given, but no breathing tube can be placed. So there are situations where the patient is a full code, everything is done, including CPR, multiple cardiac medications, breathing machine. Some will recover, some don't. But there's also this group of patients who are still in life support, and however they get more organ damage, say the kidney fails, they're on dialysis, they require multiple IV medications to support their blood pressure. The breathing machine or the ventilator is delivering oxygen to its maximum capacity, but there's no improvement. So at this point, the family members, including the power of attorney, should have a new discussion, readdress the code status. So some family members will say, well, my loved one has been on this life support for a while now, and things are getting worse, so I'm going to put a do not resuscitate order, meaning that continue whatever you're doing now, but if the heart happen to stop, don't shock her or don't shock him or don't do any chest compression. And other family members would say, you know what, enough is enough. We don't want our loved one to suffer more and be on vegetative state, and we want palliative care. Then palliative care referral will be put in. And then what palliative care means is that you basically are switching from treating to comfort care, comfort measure, by giving some medications to make sure that patient is not having any pain, and literally all the tubing such as the ventilator and dialysis will be turned off.
Thank you so much, Dr. Shoei. I think the information that you provided us is so critical, and particularly in the COVID-19 era, is that those are all the things that we experienced as a family. So thank you for that insight. Back to you, Winter.
Yeah, no, thank you all for your insight. We're gonna move, well, first I want to highlight, yeah?
I just want to add one more thing to what, Shawit said so eloquently. One of the things that we have to remember is that when somebody is in such a condition where they're not, they have everything, they're supported by machines and they have, let's say, dialysis, multiple organ failures and all that, but there's no family, or there's nobody really to guide how the doctors what to do. Then they have an ethical committee, or they have also hospital lawyers that they would say this is a futile care, meaning that it's not worth anything. It's not going to materialize to anything that is positive in this life, except to generate and just continuous discomfort to the person. This person is always getting their blood work done. They're doing all kinds of stuff with them 24 hours, and it's just not keeping them on the ventilators only. And so, and then this is also causing thousands and thousands of dollars a day. And so the hospital would take legal, approach to, either terminate the continuous management of the patient until either somebody else takes over. And so those are the other issues. And what we don't want is people to fall into where the hospital has to be forced to provide those things, or come up with some legal things or ethical committee to decide, well, based on all the existing evidences that we have, we can't really support this person, and it is a futile care, and the hospital has decided and has a legal right to do those things. So that's what we don't want. That's why these healthcare proxies or living will are so important part of it. And the other thing that I wanted to add was basically what happens is a person dies, and there's no healthcare proxy, there's no power of attorney. What power of attorney, there's a healthcare, and also there's a property and other ownership of that person's wealth or whatever it is. And so if you have not designated anybody, and you have worked all your life, and you have your savings or whatever it is, you have property, and it would be so difficult for somebody to come in, a family member or so, going through the laws and the court system to navigate, to say that he has a family, or he has a son, or he has it's very, very difficult. And most people don't win. And guess what? All that, whatever property or wealth that person has, goes to the state. And so it's very important. There's a medical part, and then also there is a social part that we have to think about this, as all of us, not you guys, but as most people are getting older in the United States, and we have to know what is our legal rights and what do we need to do to prepare for those things. And the other thing also is that we have a right for interpretive services given under any languages, as long as the hospital is paid by Medicare or providers or other medical doctors, the person has a legal right to demand interpreter services into the language that they're comfortable with. And we cannot accept a doctor says, well, sorry, can't see you, I don't speak your language. That's not acceptable.
Thank you for that added point, Dr. Hanna. I think we've got some great key points out of this discussion. I want to thank you all, before we move over to the Q&A session, for truly highlighting the importance of having one person in the family in charge of directing those communications between the family and the medical team, to really lead that initiative, but also the importance of preparation. I don't think death is ever something that we can truly prepare for, but we do have documents that can help ease the burden on our family members if that day was to come. So once again, thank you. We're going to move over to our Q&A session. Participants can they can raise their hand. There's a function on the Zoom to do so, and you can be unmuted to ask your question. Iyasu?
Yeah.
Yep. Do you have a question?
It's not it's a question, but mainly really a comment. Number one, I think having such great Eritreans giving wonderful advices, I think we should be proud. I hope everybody is taking advantage of this, and congratulations to you and Mangus also for organizing. I have my deep feeling for Adiam, who had the strength to tell us about what she passed through. And I think the other thing I just wanted to mention is, which is an unfortunate thing, the system here, which is really from the healthcare system, and that is the primary healthcare is the key as far as I'm concerned. I'm a specialist myself, but still, I think I have my respect to primary health care. The main person, or it could be a doctor, or it could be a nurse practitioner, what have you. I think it should be the main person who should work as a liaison, as a care of the patient, in decision making, in everything. Unfortunately, this is not really in practice. What happens is, in severe cases where subspecialists are needed, patients are moved to the specialist. That's where they end. And then when it comes really, when the family really need really nice communication, explanation, the primary health care is not. But so my personal advice is really, I'll be very adamant that people should choose really a good primary care person. I think this is really in all aspects, when final decision making, for example, the specialist is going to be to the end, but I think the primary care is very important. Unfortunately, this is not happening in many cases. So I would say that I think stressing on the primary care. I think the others are well described. I don't think I need to go into. Dr. Showit has done fantastic, explanation of the system in regard to it, the resuscitation and other things, So that's what I would suggest, that I think having good relationship with the primary care and depending on the medical care helps. Now, it all depends upon the disease too. If it is something chronic, like HIV, we went through that many years ago, that is different. That maybe the specialists probably may have to take over in many aspects, but still primary health care should be involved and should be in decision making. That's what I want to say. Thank you. I appreciate that.
Thank you, Professor Yasser. We have questions in the text group. Sorry. The next question is, can the power of attorney change the code status once a treatment has started?
Okay, let me answer that. Well, the patient, while still competent, can change the direction or the instruction, but the power of attorney cannot. What is going to happen is that if a patient says, if I'm in a terminally ill situation, do not resuscitate me, the power of attorney cannot say, I think she or he is going to make it, and I'm going to put them full code. No, that's the whole point of having an advance directive, is for that power of attorney to respect your wishes.
Thank you. And we have another question. Hello? CJ?
I think he's muted.
Hello,
Hello?
can you hear me?
Yes.
How are you, Winter?
I'm good.
How is everybody? Dr. Showit, Dr. Adiam, and Dr. Hannah.
They're all
Very
here.
good.
Doing well,
Yeah.
thank you.
First of all, I would like to thank you for the time you took on making the awareness to our society. I'm so grateful, and thank you for sharing your personal experience in these times. You have already covered so many interesting points, but I think my question may be out of the topic. Since you are the doctors that I would like to have some insights. Can I ask a question? It's about the vaccine. Is that okay if I ask a question about the vaccine?
Sure.
Okay, so, are you Dr. Hannah? Dr. Adiam? Dr.
This is Dr. Hannah. I don't think we have any mind for you to ask us at all.
Oh, okay, Dr. Hannah, and for all the doctors, with all due respect, you see, there is a big big misconception about vaccine in the world today. So as doctors, do you recommend the vaccine? Are you pro-vaccine or not pro-vaccine? Because especially at the first time when the vaccine is came, it is being said a lot of people would lose their lives. So there's this thing of not knowing what to do. Can you give us some awareness about what our society should do? For example, I am not pro-vaccine myself because I believe our body has a natural immune vaccine. It has a natural penicillin. So myself, I am the one in the world who would not do that. But I like to have wisdom from you, wisdom and experience you guys have. And it would be nice if you can say something about that because it's going to come. I was hearing the other day, it's going to be $16 for one vaccine for dose, but there's an agreement with the companies that it will be free. But anyway, what do you think on vaccine? Um,
So you're talking about the COVID vaccine or just general
yes.
vaccine?
No, the COVID vaccine.
Okay, so we are scientists, and so we, with evidence-based, knowledge is what we believe, and I'm sure Sherwood would agree with me.
I
And
do.
I would just say that I'm a pro-vaccine. Okay, vaccines have played a major role in averting many catastrophic diseases in the world. Okay, we're
Okay.
talking about polio. We're talking about measles. We're talking about meningococcal diseases, meningitis. There's just so many of them. And I don't think they would exist if they didn't have a benefit, okay? And so I'm myself an infectious disease specialist, and so I'm a very much advocate of vaccines because these are vaccines against infectious agents that really kill people, okay? So what we don't know is about, COVID. So imagine the amount of infectiousness this virus has. I don't have to tell you, all you have to do is look at any news and look at all these red lights everywhere in the whole United States, okay? 67,000 new infections a day. You understand? That means in Texas, you have seen those trucks, refrigerated trucks waiting for bodies to be put in, just like it happened in New York. So that's going to happen everywhere, okay? And what is the only thing that we have besides social distancing, wearing masks, and doing every kind of things to prevent ourselves and loved ones from getting COVID? The only thing that is left is vaccination, okay? So it's in its infancy. We don't even know if it's going to work. Is the vaccine going to be a yearly one, or is there a 6 months one? For example, flu vaccine, saved many thousands and millions of lives, if you ask me. Okay, because there are people that die from complications of flu itself. And so every year, starting sometime in late August, we start vaccinating for flu, okay, because we know it works. And so, but we've had many years and sciences behind the validity of flu vaccines, even though it changed from whatever the season may be. But in COVID, because of these horrible pandemic, that is viewed as the only thing that is going to control this disease, okay? And there are people that are actually healthy people volunteering and being vaccinated. And, we will know what the side effects would be. So you have to look at what is the benefit versus the worst that can happen. And so if the benefit outweighs the disadvantage or the worst thing that's going to happen, I'll go with the benefit, okay? And so I don't want to die from COVID. The minute they have vaccine, I'm going to take it, okay? Not only me, and I'm going to make it available if it is for me, and advise all my patients to be vaccinated. I take care of HIV patients, okay? I have a lot of HIV patients, they're immunosuppressed. I have a lot of diabetic patients, they're immunosuppressed. We have a lot of people on some sort of biologic for different diseases that puts them at immunosuppression. We have asthmatics that are taking, intermittently steroids to take care of their breathing system. We have people with lung, tobacco-related lung diseases that they have to be on these medications. So we have a lot of immune suppressed people that are at risk already. You know who's dying, right? These are people that are complicated medical illnesses, and there's nothing that is stopping this virus. And so, yes, I would go with the vaccine. But, people are different. They have different views. They're anti-vaxxers, I don't understand why my child that is vaccinated or, going to school and there's an unvaccinated kid, people may not have, reached or completed their vaccines. Why should that unvaccinated kid in the schools affect the others? The same thing. And so if you're not vaccinated, so you're going to carry the disease, you have a risk of getting the disease than a vaccinated person. And so therefore you are the vehicle for transmission of the disease to others. And so it's not just about what you want. You have to look at the society as all, public health. And so we just have to really think about those things, not only about what we feel, but what are we doing to our community and society.
Thank you, Dr. Hanna. I think we have a follow-up question on how can we strengthen our immune system as we go through this time. Dr. Shoei, maybe if you could take that on.
Mm-hmm. So strengthening the immune system, it all goes back to, the basic stuff, eating healthy, exercising, addressing our chronic illnesses, and controlling our risk factors. If we have high blood pressure, the more stricter we control our blood pressure, our risk of having complications from other infections such as COVID is less. If we are diabetics, making sure that our blood sugars are controlled makes a huge difference in preventing worse outcomes. So it's about eating healthy, it's about exercising, it's about taking the initiative to take care of ourselves. There's some studies out there who mention some supplements such as vitamin D and some supplements, but as far as you're eating a healthy and balanced diet, you will have a better immunity compared to not.
Thank you. Our next question is, at what point does the patient appoint a power of attorney?
At what point? Well, it should be at a point when the patient or the person is competent to give decisions. It shouldn't wait until the last stage when that person is mentally ill or is unconscious. It has to be, literally every adult has to have advance directive. Every adult has to have somebody as a power of attorney and have instructions in a living will, because anything can happen. If I don't have advance directive and God forbid, I drive out here and have a bad car accident and massive intracranial bleed, it's too late for me to make any decisions at that point. But it's when we are healthy, when we are able to give good medical decision, that's the time that we have to do it.
Can I just add one thing into that? So age 18, by the age 18, anybody is, emancipated adult, okay? They can start making decisions for themselves. Anybody, so in primary care, from age 18, we advise people to do power of attorney or proxy, healthcare proxy. Annually, when we do, physical exam, we look at those things. That's one of the stopgaps, what we have to do. We call it health maintenance, which is there are age-based things that we have to do, vaccinations and screening tests and all that. Healthcare proxy is one of those. And so when the person, as Dr. Shoei say, when they're the healthiest, when you are the sanest, it's that time early on to decide. You don't have to be compromised and old to come up with this thing.
Definitely. We have Another question from Ms. Edgar.
Okay. Thank you, Quintana. I appreciate that. I want to say thank you, first of all, to all the physicians on this, to the doctors for the selfless act of kindness of servicing our communities. We appreciate your courage everywhere. And I also particularly want to say I am sorry for Dr. Adiam's mom. So my question for all of you is, I've been listening to stories that some of our loved ones are passing, and the retention of the body for a certain number of time is passing for many reasons. Obviously, people want to have different kinds of burial processes. But what my question is that, can you identify that, is the body, when it passes, does it have the virus in itself? What's the contamination rate there? What are the obviously the risk factors of people going to various kinds of burial services and any other things? And thank you.
So in terms of at the time of passing, is the person infectious? Well, you know, it depends on how sick they are. Sometimes the virus hangs into the 80 days, whatever, but then is it really virulent or not? Is it infectious or not? Nobody knows. It could be just the virus particles that are testing positive. So even an individual that really their symptoms are 14 days is what we say that the infectious rate, and by then the virus should disappear, right? But there are some people that are past 14 days that carry the virus, and we still the science is not out there whether these people are infectious or not. Okay, but what it is that most people that are dying, they have been already, it's been past 14 days, and nobody's going to test a body whether the virus is there or not. Okay, so the assumption is that probably the virus is gone and the person is not infectious. And secondly, the fact that the body is prepared. Okay, usually at the funeral services, and these are the people that actually deal with this, where they have, of course, preps and stuff. And so I don't believe that there would be, a risk, the body would have a risk of transmitting, to the grounds or what, because we don't really know that. But I think I want Adiam to explain what the process she went through in terms of, transferring the body or what the aftercare.
Sure. I think again, it was very difficult because this was not what the outcome that we were anticipating. So when that happened, and particularly in the area that we were in, it was just a lot. And so I think part of it was that just making some quick decision and getting our family together to be able to just make the right decision as best as we can. So that's what we did as a family. And so I'm not sure in terms of medically, I can't certainly speak to that, but I can tell you it was difficult, especially in a time like this, because we weren't able to do what we think was appropriate and what needed to be, because of the state that we were in at the time. Still a little bit much different now in terms of gathering and doing all the type of services, but that was another challenge, perhaps another call for that, because that experience was also a devastating experience in terms of what we needed to do culturally, spiritually. That was very challenging, and so I think we just took it to the best that we can at the time.
We have one question on what is there specific power in certain types of food in boosting the immune system?
I think everybody claims, these are like, what do they call them? Antioxidant. Everybody claims antioxidants, so berries or whatever it is. I don't know. I don't think there's any scientific evidence, to be honest with you. When we talk about scientific evidence, we're talking about randomized, double-blinded study to show which benefits, which did not. I don't think we have that, but a lot of industries or organizations claim that they have the power of this and that. And so I don't think that there is anywhere, even vitamins are not, you know, supposed to be provide you anything that is substantial unless you are not eating. Okay. If you have eating disorders or some sort of, then you're not eating the most appropriate or well-balanced meal, then we add, you know, supplement. Older people that have digestive issues, we have supplements such as Ensure and things like that. But these are needed substances to replace what the patient is not getting. But for a healthy person, I just don't know. I mean, maybe Dr. Sherwood, do you have any idea?
Well, my take into this is that what is the point of taking supplements when you are eating balanced diet and exercising, but at the same time you haven't controlled your chronic illnesses? I see this all the time. You know, I have patients who are overweight, I have patients who smoke, but they still come and ask me what supplements can I take to prevent heart disease. Well, you need to control the risk factors. So I think more than supplements, we need to talk about how do I control my risk factors? How can I lead a better, healthy life? And for the most part, as a cardiologist, 85% reduction in heart disease if you do the right thing. There's no medication that can do that. So to me, supplements, except for those patients that Dr. Hannah mentioned, people who do not eat, who are critically ill, you know, you might supplement some supplements, but otherwise, it's just as how balanced is your diet? How much activity do you do in a week? How do you control your risk factors, including if you're diabetic, if you're high blood pressure? Those are more important than anything else.
Thank you. Dr. Adiam, I think this would be a great question if you could answer. How do we ask about trial therapies and medication?
Trial therapies and medication. I think one of the things that we did was look at, like I said earlier, look at the policy of the hospital that we were dealing with was leading the effort on the research of COVID and treatment of COVID. So one of the things that was very helpful was to be in that type of hospital setting. So looking into their policy and understanding what they were sort of laying out as to the criteria of patients being eligible for the trial treatment. So we use that as a guide to really advocate and know that, I have to be honest, we did a lot of research too in terms of trying to understand what treatments were coming out, what they were being said in terms of the outcome of those treatments. So really having the conversation, looking at the hospital policy in terms of what type of treatment they were performing. And remember during that time, especially during that March, late March, April, a lot of hospitals were doing different things. So this hospital happened to have a lot of the trial treatment that in the US that were being trials. So that gave us sort of an advantage to really try as many trial drugs as possible, or advocate for those based upon the criteria the hospital set out.
Thank you. Is there a central resource that you use to look into what kind of trials were coming out?
Yes, but like I said, in the website, they had dedicated a COVID-19 sort of link that we used as a guide, as well as talking to a lot of the medical advocators that was helping us in this whole process. Dr. Shoei, Dr. Hannah, they were also instrumental in giving some insight into some of the different trial drug, but also just, like everyone else, we were also paying attention a lot to the news as to some of the things that were happening and look up those information and talk to the doctors as they were giving us insight and update on the condition. We asked questions and we tried to see what we need to do or what they feel that was appropriate. So a lot of questions, a lot of media we looked at, as well as, like I said, I can't emphasize enough having the medical doctor support to be able to talk through and see what was out there at the time.
Winter, I just want to add, in terms of overall research, overall drug trials, okay? I think what it is, if somebody lives around, let's say, or they are affiliated with a large medical center that is, robust in research in different diseases, diabetes, hypertension, heart disease, whatever it is, it would be nice to know. You can go on their website, what kind of studies that they have. And you should ask your doctor, let's say if, well, you know what, I cannot provide you anything. I mean, this is what's going on. The specialist says this and that and that. Ask for, is there anything that I could participate? Because as people of color, underserved or underrepresented, we lack the ability to involve or to be enrolled in studies and clinical trials. For example, in Boston, people that live in the city of Boston, they have these major hospitals like Mass General, the Brighams, and all those places, the Harvard, the MITs. These people that are within the city have the highest advantage of getting these, amazing clinical trials. Those are, avant-garde, but people that are not in the city, that are outside the city, even 20 minutes drive, do not have those options. So I think we need to ask, is there anything else in the trial that I could participate? It doesn't matter. Yeah, am I going to be a guinea pig? But if it's going to help me, because during the study, guess what? They check everything wrong with me at that time. And so the benefit is higher than anything else.
Thank you. We have a question focused on potentially going back to school. For those of us still in school, can you explain the dangers of going back? Simple things that we can do to prevent the spread with what we have. Dr. Shawit?
So, well, first of all, it depends which state you live in. If you're living in a hotspot area, versus in places where, if you live in Europe where the incidence of new cases is dramatically decreasing. So the measures that you can take is going to be different. So for instance, in California, the plan was to open schools soon, but that plan was blocked because the incidence of new cases has been increasing. So now the question is that when you go to school, especially if you have kids, when they go to school, I mean, luckily enough, kids has not been showing much symptoms with COVID-19 infection, even though they can acquire the virus. But the question is that when they go home, they are going to give it to their parents, grandparents, who most likely are going to be elderly and have chronic illnesses. So my take, if you ask me, my personal opinion is that in places where the incidence is dramatically increasing, it's better to back off and do online learning compared to, as opposed to going to a classroom. So what kind of social distancing are you going to ask 8-year-old? In a classroom, you might achieve that. But once they go on a recess, I mean, who's going to guard them, each and every kid, to keep 6 feet distance? I'm not sure what Dr. Hannah thinks about it, but this is my opinion.
I mean, I agree, and especially in elementary school. I mean, what are you going to do, 5-year-old? This kids, they get sick, they vomit on you. I mean, I was listening to CNN where a preschool teacher was talking about, I love my kids, they vomit on me, they snot on me, they do all kinds of stuff, and they come and grab me in every way. How am I gonna, you can't. And how are you gonna keep a mask on these kids? All right. And so I think the saddest thing is that this became politicized as opposed to public health. Absolutely. And I think politics is driving to the disadvantage of these people. And I think it has become up to the parent, up to the people themselves to really protect your kids. And I wouldn't, as Dr. Shawit said, if it's a hot spot, I wouldn't. Massachusetts, we're like, the prevalence of COVID is almost about less than 2% at this time. And but they still have not really decided to open school or not. Most of the universities are online for now. There are very few that are bringing kids in Massachusetts, I mean, in the Boston area, Massachusetts. And this is, we're not hot. We are less than 2%, but still, we don't know what's going to happen. These kids come from different colleges, from different states. They could be coming from hot states. Well, right now, if you come to Massachusetts, you have to be quarantined for 14 days from majority of the states. And so what does that mean to people coming from different places, different countries? And so I think we just need to wait and see what it's going to come up in terms of, but in California, all these red places, the map is all red, the 21 or the 38 states, I wouldn't think about school, to be honest with you.
So we're going to go ahead and take one last question. Two, sorry. For those who recovered from COVID, is there any chronic condition that needs to be managed?
So I'm going to answer that because, there was really a very important ground rounds given by Harvard Medical School recently. And basically the whole thing was about post-COVID, post-hospitalization, in terms of what happens to these people when they come up, what do you do, depending on what it is. And so, we really have to be careful, and it's not a generic one fits all. It depends on what the patient came out with, each individual really to look at what is their outcome. So what they were talking about is people that had been in ICU for quite some time, and their transition to, a rehab, even though their disease is fine, but majority of them are still on vent, majority of them, the ones that are out, they still have respiratory symptoms, shortness of breath, very fatigued, lack of energy, and some of them can't even walk. Okay, and these are people that had been in ICU. But how about the ones that just had a little bit of a pneumonia and they're out? Well, there's such a thing called a brain fog they talk about, that people can't really seem to really have a clear mind, or they tend to forget things. There's anxiety, there's what we call PTSD, that people feel like they're gonna get sick again. There is depression associated with it, not only with the patients, but also with the family. They were showing one woman where her father basically had to be, got sick on 911 and was intubated for weeks. Patient is back home now. The daughter has nightmares. Is it going to happen again? From anxiety, can't sleep. So there's psychological, there's neurological, there's physical. There's in so many aspects that disease, that this infection has affected people that have recovered, and that people do not know. From this conference that I attended virtually, they actually are starting studies to follow these people, or they're looking at multidisciplinary approach. The cardiologist, because patients are tachycardic, the heart rate is always, and they get tired all the time, fatigue. The lung doctor, because some of them still have issues to where they have to use inhalers and other medications, and physically they're weak, and the physical medicine doctor, okay, and the primary care doctor. So you still have to have all these multidisciplinary group working to benefit this person to where they may move on to a normalizing. They're saying that it's going to take months and months, even with the slightest idea. So my message to the young people is that, our disease is mild. Even people with mild disease that did not require hospitalization are having neurological effects, mental effects, and all kinds of other things that we have never seen before. And people have no idea yet what to do. If you're depressed, if there's an anxiety, a psychiatrist or a therapist should be involved. And so I think the primary care docs are really catching up on these things, because there's a lot of literature that's coming out, and the disease process does not stop. It is progressive, but they think that it will go away, but depending on where the baseline of the patient was. I mean, seriously hospitalized with ventilation versus just a pneumonia hospitalization versus an outpatient, even unhospitalized or patients that was just at home is having difficulty with those things. I mean, they have some survivors have a blog now where they talk about their symptoms, and so as a support system. So that's how bad it is.
Yeah.
I think the other thing that we have to also educate our community is that COVID infection does not mean that your lungs are the only organ that's affected. It can affect the heart. Actually, in some research or some data show that about 18 to 25% of patients who are infected with COVID-19 have cardiac or heart involvement. They can end up with congestive heart failure that they need medications as an outpatient. And patients with COVID infection, while they are in the hospital, can have stroke. So when they go out of the hospital, they need to have physical therapy, they need to have occupational therapy, and some patients can have blood clots anywhere. It could be in the brain, it could be in the lung, it could be in the legs. So they need to be on medications, and primary care physician needs to follow these patients. So far, we don't know how long they have to be on blood thinner medicines, but it just, we just have to take it one step, on a day-to-day basis to decide. So as Dr. Hannah said, cardiac involvement, lung involvement, kidney involvement, all these things are so obvious that, it might not be missed. The physician group who are taking care of the patient as an inpatient will make sure that this patient has continuity of care. But the most important thing that you don't see it right in front of you is that mental health. Mental health, patients who are coming out after COVID infection, the depression rate is unbelievably high. So they need to get counseling. They need to get that mental or behavioral help to, to sail through this.
Thank you. So, Dr. Shoaib, if you could just very briefly answer this final question on going back to boosting immunity. Is there a role that fermented foods or vitamin D plays?
Well, I don't know about fermented food, but
You don't drink. You don't drink kombucha, I think.
I believe in studies that involve many patients, and I trust studies that involve different demographics with a good outcome, and I'll take it. But if I don't have to base my conclusion on any trials that are randomized, it's very difficult for me to give any recommendation, number one. And number two, there are some studies that say patients with vitamin D deficiency have worse outcome, or the COVID infection will be severe in those situations. So, routinely in our hospital, we were giving vitamin C and vitamin D for whatever it's worse. But I don't know, I'm not sure about fermented foods. Dr. Hannah, do you have any input?
No, I don't. We're talking about kombucha, whatever, and kimchi. What about injera? It's fermented, you know what I mean? And so
You still need the studies to prove that. It's yummy, but you still need a study to prove that.
Exactly.
Great. Well, thank you all. Thank you to all our listening members for all of your questions. Thank you all, Dr. Shoaib, Dr. Hannah, and Dr. Adiam for speaking with us. I would like to open it up if you have any closing remarks you would like to make.
Sure. I just hope that our conversation today will inspire all of us to really take this terrible virus that our society is dealing with. And I hope that we take some of these protocols that have been laid out for us to, first and most, to protect ourselves on an individual level, as well as our family, our community, and the global as in general. And to really take our health, and I know that's one of the things that we learned through this experience, is take our health very seriously, to really put things in perspective, and taking action. Really, one of our goals today was to really get all of us to really think about this and have a conversation. I know sometimes it's difficult. Culturally, sometimes it's hard to have these conversations. I know that's something that we experience as well, but we have time to really talk this. And this virus goes across age, across gender, across everything that we could think of, and certainly across culture. So we do have this opportunity to really do something by really taking all the advice today, and particularly the advice that we heard from Dr. Hannah and Dr. Shoei, to really go and take action and really protect ourselves and our loved ones, and be advocate for ourselves and our loved ones. So thank you so much for giving me this platform to share our story with the audience. So thank you.
Thank you.
Well, my take on message was, know your rights and exercise your rights. Get informed so that you can make an informed decision, and also open a conversation about advance directive, with your spouse, with your family members. And you really don't have to do the living will only in one way. You can change it anytime if you want to, but it's important to open that conversation. And you can, base that on your, social values, religious values. And it's okay to talk about those things.
So one thing that I just wanted to say is that I think with COVID, what do you do to protect yourself? Oh, I stay home. I don't do anything. I don't meet with anybody. I don't do that, which is kind of a danger in itself. And then so I think we need to put our mask, if needed, gloves, and start walking the walk that we need to do, because we have to move. We have to exercise. One of the things that we noticed with COVID is that we told everybody to stay home. Well, people with heart disease, with other comorbidities, were skipping going their doctor's appointment, and actually not even going to emergency room because we told them don't go to the hospital. And a lot of them had horrible outcomes. People with heart attacks, other respiratory illnesses. There are people that really compromise their health for not going to emergency rooms or going to their doctors. Now, there's such a thing as telemedicine. All of us are doing telemedicine or virtual medicine, which is either through the video. I see you, you see me, we talk. If you have a rash, I will know what it is. If you don't have a way to see me, then we talk on the phone, and I will try to address whether it's the diabetes or the high blood pressure. I think clinics are coming up with all kinds of things where blood work could be done. I want to make sure your A1C is still okay, the diabetes is still well controlled. And so we cannot forget the primary illnesses, the basic medical illnesses that people have, and you need to pay attention. COVID is a distractor. We cannot just focus on COVID and forget the other one, because we are seeing that a lot of our patients are really falling behind in a lot. And so what we're doing in my hospital is basically we are actually outreaching to those high-risk patients and bring, and contact and do the visits. They need to, we have to bring them. We have a safety area, and we have to reassure them our hospitals, our clinics are safe for you to come to have this important thing to be done. Hospitals are opening in Massachusetts, and I don't know where it is, but things that were passed, whether it is mammogram or whether it's ultrasound or whatever, they are being rescheduled and patients are coming back. And so please, just do not isolate yourself at home. You have to maintain your medical care, all the other stuff, because these are the things that make people sick. It's the uncontrolled diabetes, the heart disease that makes the COVID infection worse, and where patients don't do well. And so my advice is, let's stay healthy, let's walk, let's take our medication, and keep your medical appointments or whatever you need to do.
Thank you all so much. And once again, thank you to our listeners joining us from all over. Just to wrap things up, preparation is key. Continue to take care of yourselves. Prepare for the future. We are going to get out of this eventually. So stay healthy, stay safe, and we'll talk to you next time. Thank you all.
Thank you, Winter.
Thank you, Winter.
ዝኸበርክን እንተኸታተልትና ሎም መዓልቲ ሓምለ 25 እዩ ዕድመና ኣኽቢርኩም ኣብዚ ምምፃእኹም ምስጋና ነቕርብ ኣቐዲምና ሎም መዓልቲ ሰለስተ ኣጋይሽ ሒዝና ቀሪብናልኩም ኣለና ንሰን ከዓ ዶክተር ኣድያም ንፈለማይ ግዜ ብዝትመፅእ ስለ ዘላ ድሕረ ባይቶኣ ባክግራውንዳ ባዕላ ክትገልፀልና እያ እተን ካልኦት ግን ኣሕዋትና ዶክተር ሃና ሃብቱ ፍሉይ ክእለት ናይ ኢንፌክሽስ ዲዚዝ ናይ ተለጋጋቢ ሕማም ሃልይዋ ካብ እዚ ለበዳ ካብ ዝጅምራት ሒዛ ስጋዕ ሎም መዓልቲ ክትምህርን ክትሕግዝን ገለ ዝፀንሐት ሓፍትና እያ ከምኡ እውን ዶክተር ሸዊት ገብረትንሳኤ ፍሉይ ክእለት ናይ ልቢ ካርዲዮሎጂስት ኮይና ምሳና ኣብዚ ኩሉ ጉዕዞታት ብሓንሳእ ገለ ዝኩሉ ዝግበር ዘብል ሰላኣተንን ምስኣታተን ኮይንና ክንገብሮ ቆይና ስለዚ ቀዲመ ምስጋና የቕርብ ቀፂለ ከዓ ሎም መዓልቲ ዕላል ሒዝናልኩም መፂና ዘለና ብዛዕባ እዚ ከቢድ ለበዳ ኮሮና ቫይረስ ብዛዕባኡ ጥራሕ ዘይኮነስ ክፉ ኣሎ ፅቡቅ ኣሎ ከምኡ እንተዳ ኣጋጢሙ ኣብ ስድራ ቤታትናሲ ከመይ ጌርና ክንብድሆ ንኽእል እንታይ ክንገብሮ ዘለና ምስ መፀ ጥራሕ ዘይኮነሲ ከይመፀ ከሎ እንታይ ክንገብር ኣለና ስድራ ቤትና ከም ዝብልዎ ውሕጅ ከይመፀ መንገዲ ውሕጅ ፅረግ ዝብልዎ ንዑታት ከመይ እንታይ ምዃኑ ንዑታት መደባት ለበዋታት ቀሪብና ሒዝና መፂና ኣለና እሞ ስጋዕ መወዳእታ ዓቕሊ ጌርኩም ምሳና ንኽትከታተሉ ንዕድመኩም ስለዚ ሕራይ ናብ መደብና ክንኣቱ ዶክተር ኣድያም ብመጀመርያ ዕድመና ሒዝኩ ምምፃእኺ ንስኺ ጥራሕ ዘይኮነ ዋላ ቤተሰብኪ ኣሕዋትካ ከማን ምሳኹ ኣትዮም ከም ዘለዉ ንፈልጥ ንኩሉኻትኩም በቲ ዘሕለፍኩሞ ሽግርን ፀበባን እንታይ ምዃኑን ብኸመይ ከ ካብኡ ህዝብናስ ካብኡ ተማሂሩ ከመይ እቲ ንዓና ዘጋጠመና ምእንታን ከይገጥሞ እቲ ናትና ተመክሮ ንክንገልፅ ኢልኩም ኣብዚ ምምፃእኹም ምስጋናና ነቕርብ يقولنا قليل خمسة مخانون فلتنا بشمين بشلكم تخاطرتنا جرنا مسجنا نقرب كتلنا خا نفعل ما يجزي سلت قرب سلزل خبز مدبنا أنتان مس زمنا خنا فالت أكي زي دحر بايتاخي باكجراوند خي قرب حتى رابيل كنت تقول سلنا تبونير دكتور أديم
يعني اللي دكتور مندس أديم تجاز بها تي ناتي background كورة سو أنا أب education يودي تناتي ناي دكتور ناي education حكيم ما يكون كون أو جنا درجة إنسان حمشتن عمل أب university أدرسه تناتي حجز صرحة دين ناي technology أدرسه أب university ناي graduate education أو يدمهر تناتي background
حراي صبو أبي أب نيويورك مالتيو دين حلافيت نايت ديبارتمنت مالتي
هو نيويورك كله جنا بافلو نيويورك تي تستايكا دين ناي تكنولوجي سوني إيري ناي يونيفرسيتي of Buffalo ناي graduate school of education أو أمهر
حراي صبو أما دكتور أديم فؤاد كنت أخوين قرب ندحريت كمال سكي نزل بدا خبز الجمار حجي شدشتا شعات ورحي قال خوينو امخا اب تخبابت نبرو اب نيويورك تزخف اي خوناتات زنبرو لو غزي اب نيويورك نيركمو كمي كم زنبرن كمي غيرو خان عاخن بيتسب كم زتنكفكي انت تعللنا تبونيرو
يعني الله مجمع تاجنا دكتور منجس تي دكتور منجسن تسرح تجبر زرلا إني حزبنا كان ممهل إذا نجاز جبرز الله على العالم especially with COVID عسى تشعت جبرز حمام زالله نسب كان ممهل تجبرز الله السرح أنا بحكي كمان نبغي سوي قديلي كلايكا إتن حكايم كلن أبزن حنا زحلفنا يو نعنا طرح زي كنا نقول السب أبزي سمن أمريكا زالله زي حجزاز زالله حجزو زالله وحواتنا خا يعني ليبل مجمرتا دكتور هنا دكتور شوي دكتور عالم دكتور مرحوي خلاص كمان بعث الله سبات تحجزنا يعني ليبل مجمرتا سالسيتي خا زوم سبات مسانا زالله لومي مسانا خوينو أبزي مسانا أتيوم conversation نايزي نقبرو زلنا ددلي زخونا نجا مسانا أتيوم زالله سبات كا يعني ليبل مجمرتا كم تزبط كذا كمنجس إذا نجد نبحث برتيو نقول عالم هزواز الله زي كوفيد 19 نقول هنا يوتسجم الناس الله نحن خا كم سبنا خا بسبب دين فوتو سب هجى خمان تحتيد ننسب دين نفوتو ينسب وين قربتنا وين سدابتنا وين حواتنا ويا عز أموات السب تتحيزي بزحمة نحن خا أو جزانا خا تتحيلنا عدينا خا بقو كوفيد 19 خا بقو خا عدينا مؤمتا أب مي مالت أو الصحاب أو ميتا بزحمة نبي حكي حمايو خفيو مبزأت زي مخفى أنا زحمة كأ بزح زي فلات ناتو خابي كم زبادة فيروس بزح الشجر زلاتي دمفلات نحن خا بعد قرب تحيزنا عدينا خا مي وميتا مالتي
حراي صبق قدمنا خمتي استفال ميراتات قلنا نقبركس نبرنا بشم كلنا قرنا نعخن ملؤ سدرا بيتكم صنعاتي هابكم دحريو خا ابتي كم تذكرني شعوتات كزيت هيوتكي نابراخي قلقديفكي كابتز نبركيو خوابي بافالو كابو تنكاسقيسكي ناب نيويورك سيتي متسيخي ابتطرا هوسبيتال at hospital أبزي هوتيل آتيخي خمسة دفاع حسكي أو تقالسي طبقة أنا أديخي كوينكي أو تقالسي خمس نبركي نذكر أما حجسي انتايو بخاميو نمنتايو متبع زدلي انتاي كتساقامات أقات إيمو انتايو خنفلت أزلنا انتاي خنقبا زقبا
هراي دكتور مهندس مجمرتا اتسي ناجدن أو مخادي أنا مسلابتي مسحواتي تسامع مي أزجبنا مجمرتا عندنا hospital أتعتفلني hospitalization سي أكون أتعتفلني هذا كلايكا إزي حمام كا كل medical community عفوتوني كمان يرو زين بحكي شجاري يرو especially شعوب زي مارش قلتات حدش لازم نبره نبحكي فرحاتي يرو تم حكايم كمان انتي كم زمتهم كمان شجيروهم بزح مالت بزح أنسرسي أي نبره بعد بتحرق بتسالفيت خا نحنا خماينا نفلت تبهلنا تعبابينا كا إن سدرابيت كان إخواتك شجر كرك كل سنة ناب حوات كنا بديخا نابو بخا ناب سدرابيت كمخا الساعة بأصل زقنات مس حواتي تسامع مئة مس سدرابيت تسامع مئة ناب نيويورك خيره اتخاعات خلايد خير نخا اتي حمام هذا برتعيسو جن اتنا سيستم كأن حكم رد أخوينا برتعيو نحر تقوزي لها كتأتوت لزي ذيك الناشئ أخا بزي حمام سلحمة أصلا نبرة إن أتوس لزي كأننا نجدن طرقة أو الصعب طرقة الحمد لله ناخد فلت إلنا أنا أخيري أو خامس بني طرح زي كونكم من سحواتي من استدرابتي تي تنقالشون نبرنا جن لم تزبر كونزن حكايم كله دكتور هانا تجميرو الصخة مجمرتا دكتور شوي تحري دكتور ألم دكتور مراود كلن بحنساتا نساتن كا نايف حقي زناني أو خيط كله أبتي أم يوكينا نتم حكاين كزارهم كله.
حراي صبق دكتور هانا أب إزي كم بدقة خوين كان حموم أو هوسبيتال زعتو متبع درجة فلي زبالة يمثل أبز سمين أمريكا أب كالي عالمات كم متماسسة للوجين أبز عدكين بزيادة عدلاين نتي الرأي أما بزعبوه قد قرب أرد إن نمنتايو انتاي تتقمو انتاي بخمي خي كبر
كما قاطعمو خوينو ዝኾነ ወዲ ሰብ እንድሕር ሓይሙ ሆስፒታል ኣትዩ እቶም ሓኻይም እቲ ዝመስሎም ናይ ብሓቂ ብልቦም እዮም ከዓ ክንክን ክገብሩ ይፍትኑ ማለት እዩ ሓንሳእ ግን እቲ ስራሕ ከዓ ብዘይ መጠን ብርቱዕ ዝኾነ እንድሕር ደኣ ንግሆን ምሸትን ኣበሎ እንታይ ኣሎ ኢልካ ደድሕሪኦም ተዘይጎይኻ ናልባት ሽላው ክብሉ ይኽእሉ እዮም ንሪኦ ኢና ሓደ ሰብ ካልእ ብደገ ኸይዱ ብሕልፊ ሓኻይም ብደገ ኮይኖም እንታይ ግበር ኣሎ ክብሉን እቲ ከምኡ ዘይብሉ እንታይ ሽሙ ኣድቮኬት ዘይብሉ ከዓ ክንድምንታይ እቲ ናይ ሕክምና ፍልሊ ከም ዘሎ ንፈልጥ ኢና ስለዚ እቶም ሓኻይም ዋላ ፅቡቕ ክንገብር ኢና ኢሎም እንታይ ሽበሉ እምበር በቲ ስራሕ በቲ እዋን ማርች ገለሲ ኒውዮርክ ብጣዕሚ ሕማቕ ይነሩ እዚ ኩሉ ሰብ ብርቱዕ ሰብ ክመፅኦም ከሎ ግዜ ይሁን እዮም ነቲ ሓደ እንድሕር ደኣ ተወፂዑ ኮይኑ በቃ ካልእ ነገር ዝገብሮ ነገር የብሉን ናብቲ ካልኣይ ሰብ ምኻድ እዩ ግን እንድሕር ደኣ ሓደ ሰብ ፅንሑባ እዚኣ እንታይ ኮይና ኣበላ እዚኣ እቲ ማለት ቴስት ተገይሩ እንታይ እቲ ውፅኢቱ እንታይ ክንገብር ኣለና ኢልካ ግን ጠቢቕካ እንድሕር ሒዝካዮም እቲ ውፅኢቱ ዝበለፀ ይኸውን እዚ ከዓ ብቅድሚ ሕጂ ተመክሮ እዩ ናይ ኮቪድ ጥራይ ከይኮነስ ብዝኾነ ናይ ሕክምና እንድሕር ሪኢኻዮ ሓደ ሰብ እንድሕር ሆስፒታል ኣትዩ ተጣባቂ እንድሕር ኣልዩ እሞ ከዓ ዝከናኸኖ እንድሕር ኣልዩ ኣብ ውፅኢቱ ብእንታይ ሽም ዝበለፀ እዩ ዝኸውን ሕጂ ኣብ ረፊጂ ኣብዞም ኢሚግራንትስ ኣብ ወዲ ወፅ ደቂ ወፃእ ወይ ከዓ ኣፀቢቖም ነቲ ሲስተም ዘይኽእሉ ክኸውን ከሉ የሸግር እዩ ፀዓዱ ግን ይኽእሉ እዮም ንዕኡ ናይ መኑቨር ክገብሩ ነቲ ናይ ሄልት ኬር ሲስተም እቲ ብደገ ዝመፅእ ዘሎ ግን ፀገም ስለዘለዎ እንድሕር ደኣ ከምኡ ተሓጊዙ ቁርብ እንታይ ሽሙ እቲ ሕክምና ዝበለፀ ይረክብ ኢለ ይኣምን
ኣራይ ኣብዚ እቲ ከምቲ ዝሓለፈ ግዜ ዶክተር ፀጋይ ሳይካትሪስት ኣምፂናዮ ዝነበርና ብዛዕባ ናይዚ ህሉው ኩነታት ዘሎ ብሰሜን ኣሜሪካ ሞቲ አንኮንሽስ ባያስ እንታይ ምዃኑ ኢሉ ዝገለፀ ንሱታት ኣብ ግምት ክኣቱ ኣለዎ ማለት እዩ ብዝያዳ ማይኖሪቲ እንተደኣ ኮንካ ብዝያዳ የድልየካ ማለት እዩ ከምዚ ትብልዮ ዘለኺ ተጣባቃይ ብደገ
ጥራይ ኮይኑ ብሓፂራ ቁሩብ ነቲ ናይዚ ሕማም ጥራይ ከይኮነስ ዝኾነ ሕማም ማለት እዩ ሕጂ ምሳሌ ኣብ ብርግም ዘም ወመን ዝበሃል ዓብይ ሆስፒታል ኣሎ ቦስተን ሕጂ ሪኦም እቶም ተማሃሮ ቁሩብ ሪሰርች ገይሮም እቲ ውፅኢት ኣብ ፀለምትን ወይ ከዓ ማይኖሪቲን ኣብ ፃዕዳን ብናይ ቸስት ፔን ዲ ወላ ናይ ልቢ ድኻም ዝኣተወሲ እንታይ እዩ እቲ ውፅኢቱ ክበሃል ከሎ ኣብ ፀለምትን ኣብ ማይኖሪቲን እቲ ሞትን እቲ ሕማቕ ውፅኢትን ዝበርትዖ ኮይኑ ተረኺቡ እቲ ኣግሬሲቭ ዝኾነ ዋላ ሓድሽ ሕክምና ድዩ ወላ ሽሙ ኣይፅዕሩን እዮም ስጋብ ክንድዚ እዚ ከምኡ ምስ ረኣይዎ ሕጂ ንህለ ፖሊሲ እዮም ይቕይሩ ኣለዉ ግን እዚ ከይፈለጡ ዝገብርዎ ከም ዝበልካ ዘለካ አንኮንሽስ ባያስ ብከምኡ ተላዕለ መስለኒ ሓንሳእ ከዓ እቲ ሲስተም ከምኡ ገይሩ ይድንድኖ እዩ ነቲ ሰብ
ኣራይ ፅቡቅ ዶክተር ኣድያም ናብቲ ናይ ኣዴኺ ክንኣቱ ስለዚ ሽዑ ተጀሚሩ እቲ ኩነታት ኣዴኺ ኣትየን ናብ ኣይሲዩ በዓል ዶክተር ሃና ዶክተር ሸዊት ኣለም ኩለን ኮይነን ከዓ በብእዋኑ ንስኺ ኣብ መንጎ ኮንኪ ተዋሲእየን ነርኪ ማለት እዩ ብዛዕባኡ እስኪ ቁርባ ረድአና እንታይ ከመይ ጌርክ ቀዳይ ነገር ትከታተልዮ ነርኪ እንታይ እዩ ነይሩ እቲ ስትራቴጂ ናትክስ እንታይ እዩ ነይሩ
يعنى حدا إتي مجمرتا نايجدن براكسي أو كتصحف الله سلامنتاي اسم حكيم عند حد نسخة أو نتيسب ودس إتي ناتكسب استخدام هر advocate زي براكسي عند حزي كونكا عايزارو خانيم حدا especially خا بكوفيد أسرع برتأتي عنيرة إتي وراءات حزي لها عايزارو خانيم إتي حسب خا أول لوس لازم نبرشعو الساخة ما نتغير لتصاتم كذا صح لسه ما جمعتها
يغريتها health care proxy ختب لخلقي انت مالتي اتي كم تتابعي نايتي حموم كوينكي بتصحف كتصنح له مالتي كن هو ارا
السان حزي كونه ايزارو خانيو انتي confidentiality سوزونه اسا حقس لزلا اسا اي زارو خانيو ناخا حجي نسانا قد نساس نبرت دحارة كمان دحر كوين كاس خان دحر براكسو هونكا دللي كاسا كتو تخيلها on behalf of the نايسا إسخا that's why دكتور هنا دكتور شويت كلها تنكا أتوا دخاله ساس أنا حجز لزنبرني بناتي في الأديرن نتهم حكاين كزاربو ወይ 3 ወይ ገና ቴሌፎን ክንዛረብ እሱ ግቡኡ ስለዝኾነ ኣላው ገይሮምላ ማለት እዩ ብኣገና ጀሚርና ከምኣ ምስ ተጀመረት ኩሉ ሻዕ እንታይ ከም ዝግበር ከም ዝነበረ ዓይነት ዳያግኖስቲክ ከም ዝኾነ እቲ ትሪትመንት ከም ዝኾነ እንታይ ከም ዝኾነ እቲ ነገር ኩሉ ሻዕ መዓልቲ ንኢንፎርሜሽን ንረክብ ነርና እቲ ኣኼባ ከምኣ ምስቶም ሓካይም ዳርጋ 30 ናብ 45 ሚኒት ይወስድ ነይሩ ስለምንታይ እቲ ኮሽትን ንሓትት ነርና ዘን ሕዋተን ካብ ኩላተን ሕግዛነ ነረን እቲ ኮሽትን ንዓታቶም ሰው ብዙሕ ወስድ ነይሩ እሳቶም ከዓ ርድኡ ነይሮም ከምኡም ዝኾነ ስለምንታይ ኣፅኒዕና እቲ ነገር ስለንሓቶም ስለነበርና እሱ ብነይሩ ቁሩብ እሳቶም ከዓ መብዛሕትኡ ኣይፈልጡን እዮም ነይሮም ሽዑ ዝሓድሽ ስለዝኾነ ብዙሕ እቲ ነገር ከማን ንሕና ነምፆም ነርና ኣብቲ ናቶምሲ ነምፆም ነርና እቲ ነገር
حراي صبو شعو جزيد ولا حجوين درجة مساسالي زلو نزي أنا كورونا فيروس مدهانيت أي نبرن حجي ستيل وين كأبخم وتات كنا تاتي نزلنا ما بستفعل عليه من قدي زي جينا عمتنا اعتزلو مدهانيتات يوهب نيرو حجوين يوهب علو حجي بزعبو دكتور هانا بزعبا زي investigational drugs وين كا جينا عب مرمرة زلو مدهانيتات بزعبو قد عللنا انتاي تقمو كمي انتاي مردعتا كهلونا له انتان سبوغيرنا عاتقنا انتان كنملس منتان
هو انتاي مسلكا حجي تي اب مصنعت زلو وي دما انفستيجيشنال دراج تبهالسي غنا زي تفقده اتنا فيدرال ايجنسي ناي حق فوسي زفقد غنا زي فقدلو اب ماركت عداغا خوص نسب تقامو زي تفقده مالتي ازي ناي كوفيد بدعمي ناي بإمرجنسي تباهيلو مخنياتو ولا حنت نجر سزي نبره زخونه فوسي يسرح إلو تأمنه اندحر نقشتي أريوم ولا نفتنو إزبهال نيرو سلازي تي بخالق قال مرج أسلازيلو اتزلو خابت مزنع تزلو سلازخونه اندحر قرب أفافنو تاريو ناي مسرح نتي نأنسار نتي فيروس ديو قلديو توليلوم يأتوبو مالتيو حجي مبزحتي أنا فوستات حدش تفتري كونن تفوستات كمجات أما خوينو بخال حمامات كمولو نيروم حجي مثالي كم زبعال ريدمسيفير ويدما بزح كل سي بخال نا إيبولا نيرو قاليو نا يرموتريد ارترايتس نا جلسة زخونة تي نتعشمون ودقات كم زيبلون ودسب ودقات كم زيبلون كل رئيم ولو انتاي دقالو كحجز له نتي حمام كتفو يخلو أي خلو فتبهله بتولة فيلو ملا مالتي حجي إزي خبها الكرب كم كلوسي عبي انت أشمينه برج علم كله سلزي كل جزء كم investigational drug قالوا إن حرتبهيلو كله مرج أصل زي اللي حجي دلنا ومسألة خجبرو لي ممهار خجبرو لي لما تعيد اللي نبل قداس إن حرت كله مرج أتزيلو تي تقمي كبوداتو سلزي بلت بتخيل متن تزراريبنا انت اشي مخنو بللو لنا
alright صبو دكتور شويت ابشعود جزي ذكرني بزحات معليها زي ولهم حمومات COVID-19 اب هوسبيتالكم يموتوا نيرمو بمعالتو نيركم ساعتاتهم بزعبا زي هيدروكسي كلوروكين زي ناي مالاريا مدهانيت نسخه شعوتات جزي تقوملو نيركم مو شعو خمي نيرو مزحج خي انتاي لو تتات متصيديو نزي اخمر استحنسب نزارب لما ادقس خنبلا
هراي يعني لي منقص سو ازي هيدروكسيكلوروكين دبحال كاب ادم زنبر خندي عمتات تسرحلو نخندي حومان دوهاب زنبر فوسي ن مالاريا ديو ن روماتويد ارترايتس ن لوبس دبحال حمامات نتقمالو نيرنا ستيل نتقمالو ينا ግን بوحد بلا دوز إنا نتكلم نيرنا قد محجم مالتيو إذا هيدروكسيكلوروكين مع آسيا كتزرب جميرة هذا مصنعتات كوت جميرهم كفرنساي كتشاينا ستم مصنعتات انتاي بلو هيدروكسيكلوروكين دهبناي مسبات اتي ناي فيروس متأنو أو حدوه عندنا أني اتحمام دسمعهم جزء أبديلوه زبل مصنعتات وسيم شعو أب بزح هوسبيتالات هيدروكسيكلوروكين كمزي روتين عينتي زوهاب نيرو هذا سبب ملكتنا COVID-19 حزوة تمسيو بحلفي برتع زبالة انتلوه هيدروكسي كلوروكين سي خمزي قبو عينت تجيرو يوسد نيرو مالتي بتشعو جزي جن نفلت نيرنا عينا زوم راندمايزد بهال ترايل شعو خمزي نبرو زوم بزوح كتأمنهم تقل مصنعتات كم زي نبرو نفطو بينا جن والحانت عينت مرجع سلا زي نبره بتجزيتي هيدروكسي كلوروكين نهم نيرنا مالتي دحار بدحريو جن اب كل حماماتكم حدا مصنعتي جبر دحار بزح بزباله سبقتيخا عبيد زباله مصنعتي جبر دحار فوسي يصرف ديو ايصرح نقد فلت هيدروكسي كلوروكين كات ذا سيم ثينج تغيرو مالتي دحار بزحات مصنعتات يمصو بلصات زلوم مصنعتات كوصم جمرو انتايلوم اتين هاتم كونكلوجن تاينيرو هيدروكسي كلوروكين دوسدو كوفيد 19 حموماتسي حدا سايد افكت نايت ميديسن or صعبين نايت ميديسن ترخيبوهم قال لي كمان نموت بصيحهم نمنتاي ازي اتناي لبي مهرمتي شجر ويك ام زنبال سلازم نسخ احد بي اي كي داغ ورك اخذ فلطو ممرمرناي لبي سلازم سلازي هيدروكسي كلوروكين كابتي ستاندرد اوف كير دبحال وصيو مالتي حجي جانا بدحريون كالوت مالتيبل ستاديز مصيوم مصنعت مصيوم هيدروكسي كلوروكين ن كوفيد 19 محكمي إلك خطقملو كم زي بالكائنة لو من فلد لنا ስለዚህ እጂ ናይ ስታንዳርድ ኬር ታይፕ ላይ ኮነ
alright now ናብቲ ናይ ሕክምና ኣብ ሎሚ ግዜ እንታይ ሕክምና ዘሎ ክንምለስ ኢና ቅድሚኡ ግን ናብ ዶክተር ሃና ክምለስ ዶክተር ሃና ኣብ ወርሒ 3 ወርሒ 4 ብዝሒ ናይ ሕሙማት ስለ ዝነበረ እሞ ከዓ ICU ከዓ ቦታታት ስለ ዘይነበረ እቲ መብርህታት ዝወሃብ ዝነበረ እንተዳ ስምዒታት እንተዳ ሃሊካ أو دول لحكيمك قداديمك أي تغيد ناب حكمنا يزبها نيرو حجي كما يعلو حجي حاميم سمعتات تداها اللي هو أموخا تلخيفة يخوين يزبل انت دا أخوينو عاد ودسب انتايك قبرا له معاسي خي ألو دي خي أقدم كان بحكمنا خيتك ترغبوا له انتاي يزبها زي لوتتات بلصات اللوديو ولا صاب غزا تعلفو يتزبلص باوت بيشنت مسارس خميتريو
هو حجي انتايو خنزبلكايو مجمرتا نفلطو ነገር ስለዚየሎ ናብቲ ዘድህብዎ ነበሩ ናብቲ አጸቢቆ ተወጽዕ ስለዝነበረ ኣብ ገዛ ኮንካ ስጋብ ተሓምም እንታሽሙ ስብርትዕካ ጽናሕ በሃል ነብሩ ሕጂ ግን ብዙሕ ተማሂርና ኢና ብዛዕባ ትሕማም እቲ ኮቪድ ስንታይ ዝገብር ساعدين بزح حلوه حجي بزخونه متن اندحر داوالا ساعات سعلكم تولو نعينا نبلوم مخنياتو علنا ابزي حجي زلو خوتا تيست خنقبروم نخلينا نكوفيد اندحر علنا بوتا خا بسرعه ناي ريسبيراتوري كلينكس بحال كداون تيديو زي PPE قال ملغركا بسرعه ايفالويت تقبروم ولا راجي قال لغركا دحان بقري صباحك صبحيتو خادوبلك خاتك هاتلو مالتيو اندحر داء داشمو خوينو قربنا بتنفاس صقم اندحبرت عوام شعن هوسبيتال كخدلوهم مخنياتو انت تي حجي حكم انت مخانو فيتنا لنا زي صقم بنت خمزلو حكمنا فوسخ قالو انترفنشن بزو حلو سلازي بزخونه متن اندحر داء تسمعك شعن ولا نا برايمري كير دي ولا نا emergency room خدي ازبل
alright so دكتور شويت كمي اب هوسبيتال ابزاتو بخمي حكم اللو بزلام غزي
ابز حجي غزي اب هوسبيتال زاتو بكوفيد 19 تحت استازح حسب تي مايلد ويك قرب حمام دحاسو اب غزو خويني زصن ايزوليتد كوينو ندا تخاتلكاي مالتي ابت هوسبيتال زاتو سبغن قرب زصنعو خونالو مالتي to oxygen level متقلنا oxygen بتاعم وحيدو إيو تي رسني مخاد أبي نخدي معلتي بزح كرايتيريا لو مالتي معوزاتو حجي كأتو خلو كلتا نقرأ له حدا ناي دقافاوي حكمنا like supportive care بحال مالتي oxygen تحاسيروهم oxygen تقبر لهم رسنة لهم ناي رسنة فوستيبهم كبدهم أمين نفسهم تقرأت المهم ناتو فوستيبهم بستخاء من قدي oxygen توسق بمحب اب فنتيليتر سي خمت قدم ሽዑን ኦክሲጅን ወሪዱ ለሞ ሕጂ ቬንቲሌተር ወይ ከና ብመተንፈሲ መሽን ንግበሮ ካብ ምባል ቁርብ ባክ ኦፍ ገይሩሎ ሕጂ እቲ ሬኮሜንዴሽን እንታይ እዩ ትጸንሕ ብዝተኻለካ መጠን ኦክሲጅን ድሃብካዮ ትጸንሕ ካልኦት ከኣኒ ናን ኢንቨስቲቭ ዝኾኑ ማሽናት እዮም ግን ትቦ ኸየትኻ ኣብ ጎሮሮኻ ኦር ኣብቲ ናይ መተንፈሲ ቡምባኻ ትህቦም ሓገዝ ኣሎ ንሱ ተኣብዩ ሽዑ ናይ መተንፈሲ መሽን ትገብሮም ማለት እዚ ኩሉ ሳፖርቲቭ ኬር እዩ እዚ ሓደ ተኻልኣይ ከኣኒ መድሃኒት ምሃብ ማለት እዩ ሕጂ ከምታ ዓምተወይ ዝበልክዎ ሃይድሮክሲክሎሮኪን ኣውት ወላ ሓንቲ ኣይትህብን ኢኻ ሕጂ መጽናዕቲ የብልናን እጠቅም እዩ ዝብል እታ መጀመርያ ንገብራ እንታይ እዩ ረምደሲቪር ዝበሃል ቅድሚ ሕጂ ንኤቦላ ዝፍተን ዝነበረ ናይ ቫይረስ ፈውሲ ተፈቲኑ ኣብ ምርመራ ተገይሩ ድሓን ዝኾኑ መጽናዕትታት ዝወፁ ኣለዉ እሱ ዝወሰዱ ሰባት ናይ ሕማም ምልክቶም ይሓፅር ክንዲ 10 መዓልቲ ብሆስፒታል ዝፀንሑ ኣብ 5 መዓልቶም ወፁ ኣለዉ ማለት እዩ ይጠቅም ስለ ዝኾነ ንሱ ንህቦም ማለት እዩ እቶም ፅንዕ ዝበሎም ሰባት ካልኣይ ዴክሳሜታዞን ዝበሃል ከምዚ ስቴሮይድ ማለት እዩ ንሱ ከኣኒ ኣብ ዳርጋ 2,000 ዝኾኑ ሕሙማት ተፈቲኑ ክብድ ብሕልፍቶም ክብድ ዝበለ ብጣዕሚ ሓሚሞም ዘለዉ ሰባት ብኮቪድ ኣብ ናይ ምትንፋስ ማሽን ዘለዉ ሰባት እንተ ወላ ሓንቲ ነገር ተደይገርካሎም 41% ካብኣቶም ይሞቱ እንተ ዴክሳሜታዞን ሂብካዮም ስቴሮይድ ሂብካዮም 27% ካብኣቶም ጥራሕ ዝሞቱ ስለዚ እዚ ጽቡቕ ውጽኢት እዩ ስለዚ ዴክሳሜታዞን ዝበሃል ንህቦም ማለት እዩ ሕጂ እንታይ እዩ እቲ ኮቪድ ቫይረስ ከኣቱ ከሎሲ ዳይሬክትሊ ነቲ ሳምባ ከጥቅዖ ክእል እዩ ብዳይሬክት ዘይኮነ መንገዲ ከኣኒ ነቲ ናህና ናይ ኢሚዩን ሲስተም ወይ ከኣኒ ናይ ሕማም ናይ ምክልኻል ዝሕግዙና ሲስተም ንዕኡ የተሳስኦ ማለት እዩ ሕጂ ንስታት ክኣክቲቬት ክኾን ከሎ ወይ ክተሳእ ከሎ ነቲ ሕማም ጥራሕ ኣይኮነን ዘጥቅዕ ነቲ ነፍስና ኻ ከጥቅዕ ዝጅምር እዚ ሕጂ ሳይቶኪን ስቶርም ንብሎ ማለት እዩ ሕጂ ነዚታት ቅድሚ ሕጂ እውን ወላ ብዘይ ኮቪድ እዚ ARDS ዝበሃል ብጣዕሚ ከቢድ ዝኾነ ናይ ሳምባ ሕማም ክመፅእ ከሎ ንፍትኖ ኢና ነርና ቅድሚ ሕጂ እውን እዚ ግን መጽናዕቲ ድሓን ስለ ዘርአ እዚ ዴክሳሜታዞን ዝበሃል ተጀሚሩሎ ማለት እዩ ንሱ ንገብረሎም ና 10 መዓልቲ ማለት እዩ ካልእ ደም ምርመራታት ዝግበሩ ኣለዉ ናይ ጎንፂ ማርከርስ ወይ ከዓ ናይ ኢንፍላሜሽን ማርከርስ ሳቶም ዝለዓሉ ኮይኖም ተተረኺቦም እቲ ናህና ናይ ኢሚዩኒቲናሲ ይጠቕመና ጥራሕ ኣይኮኑን ዘሎ ይጎድኣና ስለ ዘሎ ንዕኡ መዝሓሊ ክኸውን ኢልካ ሓደ ኣለዉ መድሃኒታት ሓደ ወይ 2 ዶዝ ትህቦም ማለት እዩ ካልእ እቲ ናይ መጨረሻ እዚ ኮንቫለሰንት ፕላዝማ ዝበሃል እዩ ንሱ ከኣኒ ሓደ ሰብ ብኮቪድ-19 ሓሚሙ ሓዊዩ ጽቡቕ ገይሩ ሓዊዩ ክሪካቨር ገብር ከሎ አንቲቦዲ ወይ ከዓ ከምዚ ወታደራት ሰሪሑሎ ማለት እዩ ነቲ ቫይረስ ዝፃረር ሕጂ ንሳቶም ኢንከሬጅ ትገብሮም ደም ክህቡ ምእንቲ እቲ ደም ዝሃብዎ ካብቲ ፕላዝማ ውፅኢኻ ነቲ ሕሙም ኮቪድ ዝሓዞ ብጣዕሚ ሓሚሙ ዘሎ ንዕኡ እውን ትቦ ጥቕሚ ክህልዎ ክእል እዩ ዝበሃሉ ሓደ መጽናዕቲ እውን ኣለዉ ንሱ ንገብር ኢና እዚ ኣብ ኩሉ ሆስፒታላት ስለ ዘይርከብ ክትሓትት ኣለካ that's why እቲ ኣብቲ ዌብሳይቶም ኣብቲ ሆስፒታል ተኸድካ እዚ ሳፖርቲቭ ትሪትመንት ንገብር እዚ ዓይነት መድሃኒት ንህብ ንከምዚ ዓይነት ኮቪድ ማይልድ ድዩ ወላ ኣብ ሕማቕ ቦታ ኣብ ሕማቕ ደረጃ ዝኾነ ኮቪድ-19 ኢንፌክሽን ተኮይኑ እዚ ዓይነት ፈውሲ ንህብ ከሎ ደን ትፈልጦ ኣለኻ ማለት እዩ እዚ ረምደሲቪር ናይ ቫይረስ እዚ ዴክሳሜታዞን ናይ ስቴሮይድ እቲ ነቶም ኢንፍላሜሽን ማርከርስ ዘጉድል እቲ ፕላዝማ ትራንስፊውዥን ንሶም እዮም ኦፕሽንስ ዘለውና
ሓራይ ጽቡቕ ዶክተር ኣድያም ኣብቲ ናይ ነዲኺ ክትጣበቐላ ዝነበርኪ እሞ ከዓ ኣቲኺብቲ ሆስፒታል ትገብርዮ ዝነበርክን መዚ ሕጂ ክብላና ዝፀንሓ እዘን ኣሕዋትና ዶክተራት ምስኡ ተረኣዮ ከለኺ ከመይ እዩ ሽዑ ግዳ ተመለስ እሞ ከመይ ነይሩ ሽዑ
እሱ ዝከረኒ ዝዛረባ ዘለዋ ሓደ ከምቲ ዳክተር ሸወት ዝበለቶ ክትፈልጥ ኣለካ እንታይ ዓይነት ትሪትመንት ከም ዝህቡ ዘለዉ ትራያል ድራግ ከዓ ስለ ዝኾነ በብዓይነቱ እቲ ሓስቢሮ ኣብ ዘለኻዮ ስተይ ፍልላ እዩ ሕጂ ንሕና ግና እቲ ሳቶም ትሪትመንት ዝገብሩ ነበሩ እቲ ናቶም ሪሰርች ሓስቢሮ ከዓ ስለነበረ ኣብኡ ኣብቲ ዌብሳይት እዩ ነይሩ ግን السوق كله أي فتوان يوم يوم شو كن إتي medical records لازم نبرنا نري أن يناشعوا نستوصل لنا تنتكم لو وهابنا بلد أي وهابنا بلد نحط تسقى حتينا يوم سنة متى زي وهاب ما كنا حتى تينا أبتي شوفها حتى خما قوي مثلني يعني حكايم تيم تحكم تلاقى أسد حمشت أسترتن حمشتن لو كنا حكايم ببعيناتهم يوم أو ذراع هذا patient إحنا هجي ساتهم كأتي drug تي infection disease doctor ساتهم من decisions جوبرو أنا treatment كقبل سر دوسر أي وسر تجي نجد النسوجنا بزربات أحزي كونه صحيفنا request جرنا بجوبا منت بجوبا منتي عدينا خوات treatment دبدا بجنا صحيفنا إنا سدنا أبيهم بتزارينا يوم هراي نجوبرا إنا يوم جن أو أبتدي جزء شو أول حاجة كمان جزء يزال تي treatment سي نجد سي أبتدي جزء عند treat ذي قبل كاو تي time سي pass بس خانة جن أباس لازم حيل لنا قرو بسرعة دبدة تحفنا أدرجان تي نا CEO ناتي hospital كمان بس كمان أفتي include جنا أفتي ناتو كستان تدبدة من تسمع لحريو I think Dr. Showit تزارينا conference جنا لحرس عادن قلنا تي treatment شوت جراملا.
هاي أتي medical record تتصحفات بمعلت تجورو وقلبت هوسبيتالنا يدخزنا برسي نعون نخد electronically ب زي ما أنتان نختري إيو جلس أنتي يسو مثل ناي حموم ديو بخامي غير كوسيد كيونسو ما نبوزح فولت سبع زلوي مثلا
هو نحن هون كم جمعنا عفل أننا جن أو أخذنا تي كم تزبطوها أنت كم تزبطوها أنت وين ناي براكسي ناي جدًا خون الله سلا براكسي هون كها كله especially أبدي سمعنا من كمان زحتو patient portals بحاله مش هجسوا ناتكا جبوها ناتكا record medically كم دلاك أخترهوت غيرها it's a practice ها and have to سب كجورا زي كون to practice ها home right الله هجو home rights لزالله بقو اتناي medical records جبال نبرة كله بحقي أنا خوصلة إليه again كتوصل نحكمك daily records كجبر علىك legal شزوهني ولا حنت معتن تحجيك officially حنت أتجبر إن نكون نجدم records كجبر علىك شو سو request متى بالإلكترونيك متى شو أتي document متى بقو شو كله نرينا أتي كاب blood test دي ولا نايمك بدي كله detail أو بساعة الله becomes a practice as a home كله سو access نيرنا شو.
Alright, Dr. Showit زحلفة جزية زحلفة سمون بإنجليزية تصبغ يحكي جلس كلنا نركب زعبازيتات أقدم كاك جبر زلو حكمنا وممرهتات كم حموم وأنا وكيلي خستيو قال الكاتبه استفعل عليه اللمو انتايو قرب احتراب بالكدان قرنا ب living will خنجمر.
اوكي مجمرة advanced directives بحال إذا أقدم كاز جبر حكمناوي ممرحي انتايو. حجي إذا حد سندي حجاوز خونه سندي. حدا ولك أسبسي قبل اللي نزكايد حكمنا ومسرحتات يكون ويكا في وسطات زجلت حجاوز خونه صحف حجاوز خونه سندي. بتوسخ خاء أكلاوي يكون أمراو حمام ويكأني حدقة بدأ صعبه مخنيات ناي موسان عقمخا أنت سي إنكا أب كندخا خوينو ناي موسان عقمي أب كندخا خوينو نتي حكمنا ممرحين نسخة ذهب كايو والسانيتاتن كتجبر أكل كتجبر عليك إذا تجبر أكل تجبر السخاء حدا سندي مالتي حجزي advanced directive ويكا أقدم كاز جبر حكمنا وممرحي تنكندي كلتا عينتين اتحادة living will دبحال إمام ناي منبر دليت مالتي إذا خاني حدا سب كوحابو نزد اليوم كل عينت حكم الناوي فوستات بلك أزقلت صحفيو زي تكبر دما اتول كأسب كوسنالو زيك الدرجة كبتصح خلو طحي حجزي أتوم in general ويك بحفشاوي تتوسن كاين نجا كوف كتبلو تقليخا حجينا أبنت كحاوي ويكفوس انت زيك الكوينة ويكفوس ذيك الحمام ويكونتات انت قاتيموني بقربا زكاة لأني اتناي حكمنا بعلم وياخا أني تخلو خجبر زجبو نجارات جير اللهو كابزن العلقن زوفيو نجاري لنيلو كوسن كله أنا بهيوت نخ راح تباهيلو أباي زكايرو ناي حكمنا مسرحتات وزي life sustaining measures تبحال كقارة اللي يحبر يبل زي جنرال دخونة بقى بحافش أو خمسين كخت جبرات خليخا زي living with wake as ناي من بعد دليل هذا عينت راح يكونن سبنا تجبر خلي يدلي أخبر خلي تحدث يدلني أخبر خلي أوكي قال لي يسب كأني more specific كأزرزراوي نتزر لو غير يقرب انتايبل أنا أبكم زي عينت كونتات انت حالي كوسن انت زي كيلة فوس عنزة هابوني ويعيد هابوني مشان بق قدم زو هابني فساسي ويدلي ويدلني بتبو وبشان بق أجيكا بستماك خاتيخا مقبي مقاب أي تكبروا لي كله بب حد خطأ إلي إذن تاي مالتي زبير specific زرزير كاتقربوا لخا مالتي قال يوخ أني CPR أيدلني ياخذ بلخ إليو هرمت لبي سرعة زرد من مستنفاسن نمبربار زقبر حكم الناوي مسرح أي تكبروا لي كبلك إلي سلازي بب عينتو ممرحي يهبا كامالتيو نسا حقاوي سنديا نسا بيت قمت مالتيو مساحات قمت مستي عند حكيم primary care physician تقمت نسا مالتيو عندنا أني مستي توكلو زلخا سبون تقبر مالتيو زي كوبيكي كحت قمت أقول لك أبغى لي دركب تقبرون لك مالتيو
سلازي غير كايو مديب كايو تراح زي كونه كتنقر على كامالي
كتنقر على
كفلت على بيتسب كفلت على وانا تقول فليتهم تلاصني حمسي بتصحف على تقاداديمكا نابتي تدليت كاي مال على كاماليتي
and then نتيت وكلوز اللي خاصب حج خزاره بقى اخاني نسخ اخ هلو قدنت اللو مالتي ازي ادالت مسكونكا ادالت خونلو منسيت خونلو ادمه جميل كاخت قبرو تخيليخا ግን حنسا صحيف كايا مالت ستاكوين كا مالت ايكونن اتي تداليو ممرحتاتي كتقيرو تخيليخا خمد اللايكا اوكي سو تخال ايتي كفليناتا انتايا زي هيلث كير بروكسي دبال ويكا نحكمنا اغلغلوت وكلنا توسع مالتي حجي حدا وكسب قبل اللي يخبروا زخل كل حكمناوي مسرحات نخوسن زخلو ممرحتات زتكبر السب ويكا وكيل نحكمنا اغلغلوت زهب سنديا زي اخا تفرم اللوا كت نوترايز كون اللوا ويكا بتقبا اخ تصحف اللوا حقاون اسلس خونت ግን ازي وكلنا تبو زلخا سبسي معاسيات تكبر تاسرحس معاسيات تجمر انتيلنا اتي والكسب تزصحفا زلو تاسند والكسب از ممرحتات زحابه مالتيو ناي اكالاوي ديو ناي امراوي صقمات كركب كله اتي ناي موسان كلتو عقم مزسئن شعو اتي وكلنا استواهبو سب ساعه شعا سرح تجمر مالتيو حجن مثالي اتي وكلنا اتي تا سند قربا زلو سب ابكومات اتيو ونا البونت قصالي سنفلات زخونه هلونا ويكا فيجيتاتيف ستيت اتيو سؤال كات راح هيوت والحنتي يبلكان قلنا اميشن راح سلسه ابا كاي خات سنف زلخا مالتيو صنع زخونه مغدات حنغول ويكا سيفير برين انجري تلو ويكا او كبيد زخونه وقعي تحيزو ناي مرسا حمام ز الزهايمر تحيزو ابزي غزيزي اتي والكسب بفصم والحنت عينت وساني خهب ديك التخوين بزعبات ناتو حكمنا اتا ممرحي نسو ابتا ادفانس دايركتيف ويك اني افتنا يحكمنا ممرحي كوف زبالا اتوكل الناس وحابو سب نعا يتكبرا مالتيو ازو كنا زل وحابو زلو سب جن حجي مثالي هباكم حجي وكلنا هيبه انا انت كم زدلي كل نجر اطاطيحه ودي خوينو دحر عامت you know we venture appendicitis inflammation halini كيدنا بحكيم ከምዛ ዓይነት መጥባሕቲ ይድለኪ ተይሉኒ እቲ ውክልና ዘለዎ ሰብ መፅዩ ንዓይ ውክልና ሂብክልን ዲኺ ኣነ ብውስነት ክኽብለኒ ክልኒ ምኻቱ ይዛረብ ኣለኹ ይሓትት ኣለኹ ኮምፒተንት እየ ስለዚ ሽዑ ይኮነን ስርሑ ዝጅምር ስርሑ ዝጅምር ኣነ ፍጹም ናይ ምምውሳን ክእለት ዝጠፍአኒ ክኸውን ከሎ ግዜ ማለት እዩ እዚ ብምፍጻም እንታይ ንገብር ኣለና ማለት እዩ መጀመርያ ነገር እቲ ዝደለናዮ ንሕና ዝመረጽናዮ ነገር ይትግበር ኣሎ ማለት እዩ ካልኣይ ነገር ከዓ ነቶም ቤተሰብናን ፈተውትናን ከጋጥሞም ዝኽእል እቲ ተጽዕኖ ነጉደል ኣለና ማለት እዩ ሕጂ ሓደ ቆልዓ ኣነ ኣብ ናይ መተንፈሲ ሜሽን ክኸውን ደልዮ ኣቦይ ተይሉ ተሓንቲ ጓል ከዓኒ ክወፅእ ኣለዎ ተይላ እዚ ብዙሕ ጭንቀት ብዙሕ መከራ ብዙሕ ምቅያም የምጽእ እዩ ግን ተጽሕፍ ተላ ግን ኩሉ ብሰላም ኸይድ ማለት እዩ
በቃ ኣብ ምጥርጣርን ኣብ መንጎ ስድራ ቤታትን ፍሕፋሕ ኣይትበፅሕን ማለት እዩ ምክንያቱ ድድልየት ናይቲ ሰብ ተፈሊጡ ስለ ዝፀንሐ ብሓፀር ኣቢልኪ ዶክተር ሸዊት ኣብ ዝኾነ ሆስፒታል እትው ክትብል ከለካ ብሓድሽ ብሕልፊ ብፅሑፍ ዲኤንኣር ዊን ዲኤንኣይ ዝብል ኣሎ እሞ ኣሕፀር ኣቢልኪ እንታይ እዩ ንምንታይ እዚአን ግዳ መዚ ናይ ኮቪድ
ማለት ዲኤንኣር ማለት do not resuscitate በእንግሊሽ ማለት እንታይ ማለት ያ ብክትርጉማ ኣኽልኹ ወላ ሓንቲ ነገር ከይትገብሩ ልበይ ጠጠው ተይላ ምትንፋሰይ ጠጠው እንተይሉ በዚ ኤሌክትሪክ ጌርኩም ሾክ ኣይትግበሩኒ ኣብ ኣፍ ልበይ ኣይት ኮምፕረስ ኣይትግበሩ ወይ ካይትስቀጡኒ ኣብ ወላ ሓንቲ ነገር ኣይትግበሩ በቃ ግደፉኒ ማለት እዩ ዲኤንኣር ክበሃል ከሎ ዲኤንኣይ ክበሃል ከሎ do not intubate ክበሃል ከሎ ኣኒ ልበይ ጠጠው ተይላ ወይ ምትንፋስ ተኣቢኒ ሾክ ግበሩኒ እዚ ኮምፕሬሽን ከዚ መፅቕጣጥ ናይ ኣፍ ልበይ ክገብሩ ላይ ትኽእሉ ኢኹም ግን ኣብ ናይ ምትንፋስ ሜሽን ኣይትግበሩኒ ትቦ ኣብ ናይ ትንፋስ ባምባያ እቲኹም ሻምበቆ እቲኹም ኣብ መተንፈስ መሽን ኣይትግበሩኒ ማለት እያ እዚ ግን ኣብ ሆስፒታል ክትከይድ ከለካ ኩሉ ግዜ ዝትሕተት ኢኻ እንታይ ኢኻ ናትካ ኮድ ስታተስ ትበሃል ዲኤንኣር እንተኢልካ ትፅሓፍቲ ሓኪም ይፅሕፋታ ኦርደር ማለት እዩ ካብታ ሆስፒታል ወፂኻ ለሰይ ናብ ሪሃብ ተኸይድካ ኣብታ ሪሃብ ከዓ ሓትኻ እዮም ኩሉ ግዜ ክትሕደሽ ኣለዋ እንታይ ኢኻ ኮድ ስታተስካ ትበሃል ዲኤንኣር ትብል ተመሊስካ ናፍቲ ዘለኻዮ ሆስፒታል ነበርካዮ ሆስፒታል ወላ ብኻልእ ዲ ወላ ብደሴም ሕማም ዲ እንተመፂኻ ተመሊሶም እንደገና ክሓትኻ እዮም እምበር ላስት ማንዝ ዝሓለፈ ወርሒ ዲኤንኣር ወላ ሓንቲ ነገር ኣይትግበሩ ኢልኩና ነርካ እሞ ኢልካ ኣስዩም ኣይትገብርን ኢኻ እንደገና ተኦርደር ክትፅሓፍ ኣለዋ
ሕራይ እንታይ እዩ ምኽሪኺ ሕጂ ንስኺ ንምሳሌ ሕጂ ብናይ ኮቪድ ተጠቂዑ ሰብ ግን እንተዳ ኣትዩ ሕዱር ሕማም ኣሎኪ ገለ እሞ እንድዐይ ምናልባት ዲኤንኣር ዲኤንኣይ ገለ መነት ትኾንኪ ሓይሽ ገለ ብዝብል ዘረባታት ተዳ መፂኡስ እንታይ ትመኽሪ
ሕጂ እዚ ኮቪድ ወላ ሓድሽ ሕማም ምዃኑ ብዙሕ ኣይፈለጥና ደንፈልጦ ነገር ብዙሕ ኣሎ ግን ብዙሕ ነገር ከዓ ንፈልጥ ኢና ሕጂ ራይት ሕጂ ናይ ቫይረስ ኒሞንያ እዩ ቅድሚ ሕጂ እውን ናይ ቫይረስ ኒሞንያ መሊኡ ርኢና ኢና ጥዕና ዘለዎ ሰብ ሙሉእ ጥዕና ዘለዎ ሰብ ተኮይኑ ንምሳሌ ወላ ካልእ ሕዱር ሕማሙን እንተሃለዎ ኮንትሮል ዝገበሮ ሰብ ተኮይኑ እዚ ኤንድ ስቴጅ ተርሚናል ኢልነስ ትበሃል ናይ መጨረሻ በቃ ዳርጋ ክትመውት ቀሪብካ ካንሰር ሃሊካ ኣብ ሙሉእ ነፍስካ ዝተሰራጨወ ዓይነት ካንሰር እንተዘይብልካ ናተይ ሬኮሜንዴሽን እንታይ እዩ ኦኬ ኣነ ኩሉ ነገር ክግበረለይ ይደልየ at this point እቲ ስታንዳርድ ኦፍ ኬር ዝበሃል ኩሉ ይግበረለይ ግን ኩሉ ዓይነት መርመራታትን ሕክምናን ፈውስን ተዋሂቡኒ እንተዘይሒሹኒ ኣብ ቬጀቴቲቭ ስቴት ወይ ከዓኒ ስቑኢለ ጥራሕ ሜሽን ጥራሕ ይጠጦ ኣቢሉ ዘኺደን ዘሎ ኣብኡ እንተበፂሐ ግን at that point ከዓ ልበይ ጠጦ ተይላ ግደፉኒ ኣብኣ ከለኹ ትብል ማለት እዩ ኩሉ ሰብ ኮቪድ ድሓዞሲ ኣይመውትኒ ኩሉ ሰብ ኮቪድ ድሓዞ ከዓ ኣይድሕንን እዩ ግን ክትፍትን ኣለካ ግን ሕጂ እንታይ ኣሎ ከምቲ ዓንተዊ ዝበልካዮ ማይኖሪቲ ተኮይንካ እንደገና ከዓኒ እዚ ደኣኒ ካንሰር ነይርዎ እንዲ ቅድሚ ዓመት ኪሞቴራፒ ወሲዱ ነይሩ እንዲ ወላ ሓዊ ከሎ ድሓር እንታይ ኣሎ መቸስ አንኮንሽስ ዝኾነ ባያስ እንዲዩ እሞ እዚ ደኣኒ ካንሰር ሒዝዎ ነይሩ እንዲ ናፍቲ ሓደ ቅድሚ ሕጂ ናፍቲ ሓደ ፔሸንት ንኸይድ እስኪ ንሱ ምናልባት ሞር ሕክምና የድልዮ ይኸውን ዝበሃል ነገር ክህሉ ስለ ዝኽእሉ ኣብዚ እቲ ናይ ፔሽንት ኣድቮኬት ፅቢቑ ክሰርሕ ዘለዎ ኣደይ ወይ ኣቦይ ሕዱር ሕማም ዳ ይሃልዎ እምበር ኮንትሮል ዲ ነይሩ ዝቐትል ሕማም at this point የብሉን ዝተኣኻለኩም መጠን ትገብሩ ግን እንተ ክልተ ሓኻይም መስኪሮም ኣይከኣልን እዚ ወንሓንቲ ነገር ክንገብሮ ይንኽእል ኢና ብዙሕ ዝከኣለና ነገር ፈቲና ካብዚ ንንዮ ንላዕልኻ ንፍትኖ ነገር ወንሓንቲ ነገር ስለዘየለ ክብሉ ከለዉ ሽዑ ኢኻ በቃ ጠጠው ተብል ማለት እዩ
alright ፅቡቕ ናብ ዶክተር ሃና መቸም በብእዋኑ ብዛዕባ እዚ ለበዳ ኮሮና ቫይረስ ገለ ንመሃር ኣለና ንሰማዕ ኣለና ሓደሽቲ ነገር ከምዚ ንሪኦ ዘለና ሓደ ኣካል ናይ ሰውነትና ዘይተተንከፈ የለን ንኩሉ ዝትንክፍ እዩ ዝመስል ዘሎ ዝሓለፈ ሰሙን ኣብ ሃርቫርድ ዩኒቨርሲቲ ግራንድ ራውንድስ ነይሩ ኣብኡ ተኻፊልክ ነርክሞ እጂ ኣብኡ ዝተምሃርክዮ እንታይ ኣሎ ብዛዕባ ናይ ሕጂ ኩነታት ጥራሕ ዘይኮነ ናይቲ ሕሙም ጥራሕ ዘይኮነ ናይቲ ቤተሰብከ ከመይ ይትንከፍ ኣሎ ብዛዕባኡ ግዳሕ ፀራ ኣቢልከ ኣዕልለና
ሕጂ እቲ ኮቪድ ክንብል ከለና እቲ ብፅዑ ሰብ ኣሎ እቲ ብቐሊል ከዓ ቁሩብ ዘይ እንታሽ ዘይተሃስየ ሰብ ከዓ ኣሎ ዋላ ንሞንያ ሒዝዎ ሓሙሽተ መዓልቲ ድዩ ገለ ገይሩ ፍሳል ዝወፅ ኣሎ ወይ ከዓ ኣብ ገዛ ኮይኑ ዝሓሸ ሰብ ኣሎ ሕጂ እንታይ ደኣ ኣሎ ከምቲ ዶክተር ሸዊት ዝበለቶ እዚ ሕማም እዚ ንኩሉ ነፍስና እዩ ዝትንክፍ ናይ ኣካላዊ ይኹን ናይ ኣእምሮ ኒውሮሎጂ ማለት ናይ ሓንጎል ከምኡ ከዓ ናይ ሶሻል እንታይ ሽሙ ናይ ኣነባብራና ኩሉ ንትንክፍ እዩ ሕጂ እንታይ እዩ መብዛሕትኦም ሰባት ብሕልፊ ኣብ እንታይ ሽሙ እንድሕር ፀኒሖም ኣብ ICU ሲንድሮም ዝበሃል ከማን ኣሎ ግን እቲ ICU በብዛሕትኡ እንድሕር ICU ተኣትውሲ እንድሕር ተወፂዕካ እዩ ከምቲ ዶክተር ሸዊት ዝበለቶ መተንፈሲ የድልየካ ከምቲ ዝበልናዮ እቲ ሕማም እቲ ንሓንጎልካ ዋላ ጨዋዳኻ ዋላ ኩሉ ነገር እዩ ዝትንክፍ ሕጂ እዚኦም ብሕልፊ ኣብ ኢንተንሲቭ ኬር ክልተ ሰሙን ሰለስተ ሰሙን ገሎም ዝወፁ ዋላ ምኻድ ከማን ይኽእሉን እዮም ሕጂ ትኺሎም ካብ ገዛ ካብ ሆስፒታል ናብ ሪሃብ ገሊኦም ዝኸዱ ሕጂ እንታይ ሪኦም እዚ ሰብ እዚ ብሕልፊ ኣብ ICU ገለ ዝነበሩ ሪካቨሪ ክገብሩ ወይ ከዓ ናብቲ ናይ ቀደሞም ክምለሱ ብጣዕሚ ብዙሕ ግዜ ይውድ እዩ ሕጂ እንታይ ኣሎ ዋላ እዞም ከም ዶክተር ሸዊት ዝበለቶ ናይ ልብኻ ይሃርም ናይ ሳምባ ኣሎ ናይ ጨዋድኻ ኣሎ ናይ ሓንጎል ኣሎ ሕጂ መብዛሕትኦም ናይዚ ኩሉ ሕማማት ከዓ ሓኻይም ኣለዉ ስፔሻሊስት ሕጂ መልቲ ዲስፕሊነሪ ማለት ሲ ብዙሓት ብሓንሳእ ኮይኖም ነቲ ሰብቲ እቲ ናይቲ ፊዚካል ቴራፒ ናይ ብዛዕባ ኣካያይዳ ናይ ልቢ ሕማም ገለ እንድሕር ኣሎ እቲ ካርዲዮሎጂስት ኣሎ ናይ ሳምባ ምትንፋስ ፀገም እንድሕር ኣሎ ከዓ ናይ ፖልሞናሪ ወይ ድማ ናይ ሳምባ ስፔሻሊስት ኣሎ ኩሎም ብሓንሳእ ኮይኖም ሲ ኣብቲ ሪሃብ ናይቲ ሰብ ክሳተፉ እሞ ነቲ ሰብ ብተኻእለ መጠን ኣብቲ ናይ ቀደም ክውስኹ ማለት እዩ ከምኡ ከዓ ናይ ፀቕጢ ናይ ዲፕሬሽን ናይ ዓቕሊ ፅበት ገለ ምሽ እቲ ሕሙም ጥራይ ዋላ እቲ ስድራ ከማን ንሱ ኣለዎ ክሓውድ እዩ ሓውን ወፂኦም ሓውዮም ተባሂሎም ወፂኦም ተወፂዖም ዝኣትዉ እሞ ዝሞቱ ኣለዉ ሕጂ ትፈርሒ ኣብ ቤተሰብ ስለ ዘሎ ሳይኪያትሪስት ከዓ የብሊ ናይ ብዛዕባ ናይ ዓቕሊ ፅበትን ናይ ዲፕሬሽን ንዕኡ ከዓ እንታይ ሽሙ ይባል ስለዚ እዚ ሕማም እዚ ብጣዕሚ ብርቱዕ ምዃኑ እሞ ብኩሉ ኣፍነት ሒዝካ እንታይ ሽሙ ክልኻል ምግባር ጥራይ እዩ ነቲ ተወፅዐ ሰብ ዋላ ሕጂ ከም ኣብዚ ናይ CNN ዘዛረብ ዝነበረ ጋዜጠኛ ገዝኡ ኮይኑ እንታይ ሽሙ ይሕልፍዎ ግን ኩል ግዜ ብሬን ፎግ ይብል ማለት ሲ ኩሉ ነገር ብሩህ ኮይኑ ኣይረአይን ዘሎ ሓንሳእ ይብል ስለዚ እስታት ከማን እንታይ ሽሙ ይብል እዩ እዚ ሕማማት እዚ ጠንቂ ሳዕብን መፂ ዘሎ ሲ ስጋብ 6 ወርሒ 7 ወርሒ 8 ወርሒ ክቕፅል ይኽእል እዩ ምስ ዝኣምኑ ሓንሳእ ሓደ ሰብ ሓይሙ ካብ ሆስፒታል ድሕር ወፂኡ ኣይሓሸንን ኣይ ክፅንሕ ገለመለ የለን ትኽልካ ናብ ሓኪምካ እንታይ ዓይነት ክግበረለይ ሓገዝ ኣሎ ይከኣል እዩ ኢልካ ሽሙ ክትሳል ብጣዕሚ የድሊ ዋላ ስድራ ይኹን ዋላ ናይ ሳይኮሎጂ ድዩ ብዝኾነ መጠን
እዚ ዓብ መልእኽቲ ብፍላይ ከዓ ኣብዚ ከባቢና ንሪኦ ዘለና ብሰሜን ኣሜሪካ ንመንእሰያት ምናልባት እወ ናተይ እቲ ክእለት ዘሎኒ ንተለጋብጋብያ ሕማም ንክስዕሮ ብዙሕ ብርቱዕ እዩ ኢልካ ቁርብ ፀገማት ብዙሕ ነገራት ይረአ ኣሎ ሰብ እቲ ክገብሮ ዝግብኦ ከይገበረ ኣብ ደገ ይወፅእን የብልን ገለና ኣሎ እሞ ስለዚ ዘትብልዮ ዘለኺ ሳዕቤኑ ዋላ መንእሰይ ይኹን ዋላ ዕድመ ዝደፋእኻ ይኹን ሲ እቲ ሳዕቤኑ ንሕጂ ይኹን ዋላ ንዳሕራይ ሕማቅ ክፉእ ክኸውን ስለ ዝኽእል ሲ ምጥንቃዕ ከመይ ጌርካ ከም ትከላኸል ማለት እዩ እወ ኣራይ ፅቡቅ ዶክተር ሸዊት ናይ ሕክምና እወ ኣብዚ ከመይ ኣሎ ሕጂ ኣብ ስራሓትኩም ሓደሽቲ መፅኹም ደለው
እወ ዝገርመካ ነገር ካሊፎርኒያ ቀዲምና ስለ ዝዓፀና መጀመርያ እቲ ቁፅሪ ፅቡቅ ጎድል ነይሩ I think ኣከፋፍታና ግን ቁርብ ቅልጥፍ ስለ ዝበልና ክኸውን ይኽእል እዩ ገሊኦም ፖኬትስ ኦፍ ሲቲስ ከዓ ነይሮም ወላ ሓንቲ ነገር ናይ ምክልኻል ሜዥርስ ወስዱ ዝነበሩ ክወስዱ ዘይደልዩ ቦታ ሕጂ ብሕልፊ ዝኣነ ዝሰርሓሉ ዘለኹ ቦታ መጀመርያ ክጅመር ከሎ ቁሩብ እዮም ነይሮምና ሕጂ ክልተ ኣይሲዩታት መሊኡ ክልተ ካልኦት ፍሎራት ኣሎ መሊኡ ሶ ሕጂ ኣብ ዝገድድ ኩነታት ኣለና ማለት እዩ እዚ እንታይ እዩ መብዛሕቱ ሰብ ክወፅእ ከሎ ኦኬ ተዓፂኻ ትነብርን ኢኻ ንዓመታት ይርዳእካ እዩ ኩሉ ሰብ ተስፋ ቁርፅ ካብ ስራሕ የብሉን ቤተሰቡ ከካይድ ኣለዎ ኩሉ ርዳእካ እዩ ግን እቲ ክወፅእ እውን ከሎሲ ብዙሕ ግዜ ሓላፍነት ብዘይብሉ መንገዲ ማስክ ክገብር እንዳተገባእካ ነቲ ማስክ ኢልካ ፖለቲሳይዝ ምግባር ይጠቅም ሓንቲ ጨርቂ ብፍንጫኻ ምግባር ሲ ኣይቀትለካን ኢኖ ብዙሕ ነገር ትከላኸለልካ ኣብ ሓደ መፅናዕቲ እንታይ ይብል ማስክ ዘይገበረ ሰብ ክስዕልን ሓትሸ ክብል ከሎ እቲኦም ድሮፕሌትስ 8 ክሳብ 12 ፊት ይኸዱ እንተ ማስክ ጌርካ ግን ገሊኦም ክሳብ 3 ኢንች ጥራሕ እዮም ዝኸዱ ይብለካ ስለዚ ሲ 100% ከማን ተዘይተኸላኸለልካ ሲ 100% ተዘይተኸላኸለልካ ሲ ይሕግዘካ እዩ ምሱ ከዓኒ ኣብ ሰባት እኩብ ዘለዎ ቀብሪ ዶ በርዝደያት ዶ ግራጁዌሽን ዶ እንዳበልካ ትኸይድ ኮቪድ ፓርቲ ዝበሃል ዞም ንኣሽቱ ዝጀመርዎ ኣሎ ወላ ሓንቲ ክርዳእኒ ዘይክእል ነገር ይሱ ክገልፆ ከማን ኣይክእልን እየ ሓደ ኮቪድ ዘለዎ ፖዚቲቭ ይኣቱ ፓርቲ ትገብር ኦኬ መን ክትሓዝ መን ኣይክትሓዝን ትብል አንፎርቹኔትሊ ሕጂ ግን ንኣሽቱ እዮም ዝመፁ ዘለዉ ምክንያቱ ሕዱር ሕማም ጥራሕ ክህልወካ የብሉን ንኣሽተይ ኮንካ እውን ክሕዘካ ክእል እዩ the youngest ኣነት ዝነኣሰ ኣባና ሆስፒታል ወዲ 24 ዓመት እዩ ድርኣናዮ በቀዳማይ እውን ሓደ ዝስቁልካ ሆክስዩ ኮቪድ-19 ዝብል ዝነበረ ምስተታሕዘ እንታይ ኢሉ ኣጣቂሱኒ ኢሉ ራይት ኣብ ሚድያ ኣብ ሶሻል ሚድያ ስለዚ ሲ ብሕልፊ ንኣሽቱ ወፂኦም ከኣቱ ከለዉ ንባዕሎም ጥራሕ ዘይኮኑ ዝልበዱ ዘለዉ ሲ ነዲኦም ነቦኦም ንዓባዮም ነብሓግኦም ነቲ ዓበይቲ ገዛ ዘለዉ ሲ ይልክምዎ ኣለዉ ማለት እዩ ስለዚ ሓራይ ንውፃእ መነባብሮና ናይ እቶም መነባብሮና ክንገብር ኢና ግን እቲ ጥንቃቐ ምግባር ሲ ናይ ኩሉና ሓላፍነት እዩ
ሓራይ ሕቶታት እንዳመፀ ይኸይድ ኣሎ ድሕሪ ቁሩብ ናብ ሕቶታት ገለ ክንኣቱ ኢና ተኸታተልትና ሕቶታትኩም ስደዱ ብቴክስት ይኹን ዋላ በቲ ቻት ስደድዎ እሞ ክነንብቦ ኢና እቲ ሕቶታትኩም ዝመፀ ሒዝናዮ ኣለና ቅድሚኡ ግን ዶክተር ኣድያም ናብቲ ኩነታት ናይቲ ሆስፒታል ክንምለስ እወ ምስ ሓኻይም ትዛረብ ነርኪ ባዕልኺ ድዩ ዋላ መዘና ኣሕዋትና ብጀክኡ ግን ቀንዲ ተዋሳእቲ ኣብቲ ሆስፒታል ዘለዉ ዘለዋ ኣካላት ኣለዋ እሞ መንየን እንታይ ተራኺ ይፃወታ ከመይ ከሓጊዘናኺ
ኣብቲ ሆስፒታል ፔሽንት ኣድቮኬት ዝበሃል ኣሎ መብዛሕትኡ ኸማን ኩሉ ሆስፒታል ፔሽንት ኣድቮኬት
ቁርብ ድምፂ ክግዳወስ ከላ
ሕራይ ኣብቲ ሆስፒታል ይሰምዓኒ ኣለኻ
እወ
ኣብቲ ሆስፒታል ብስርዓት ፔሽንት ኣድቮኬት ዝበሃል ዲፓርትመንት ኣሎ ዌብሳይት ናቱ ኸማን ኣሎ ኣብቲ ናይ ሆስፒታል እዚ ፔሽንት ኣድቮኬት ማለት ነቲ ፔሽንት ኣድቮኬት ክገብራ ሰብ ኣብኡ ዲፓርትመንት ኣሎ ሶሻል ወርከር ኣብ ትሕቲኡ spiritual care ዝበሃልካ ኣብ ትሕቲኡ እዚአን ሰባት እንታይ ንሕግዘ ምስለካ ነቲ ሓካይም መንከም ምዃኑ እቶም ሓካይም ከመይ ገይሮም ክንረኸቡ ንኽእል ንስኣቶም እቲ ኢንፎርሜሽን ናታቶም እዮም ናታተን እዮም ንሳቶም ዝሕግዛ እቲ ኣረኻኽባ ከማን ኣኼባ ክንገብር ከለና ብዙም ተገይሩ እሳተን ከማን ኮኦርዲኔሽን ገይረና حجتي patient advocates إنه بحكي important السقعة كله patient وبجوبه الله patient advocate أبتعتيها social worker أبتعتيها بسرعة وهذا كاي والسجنة بعدها تكفوت لك حتى تكلك حتى كأخا ساعتهم دبخا الجسر أنا بحكي important بزي COVID-19 كا visit كتقبل سلا زي تخلكم تجوبوها الساعتين ساعتهم ويساعتين كينن أو أخرى آخر لا ينبع بعلاتن إنن نعرف جرن information كبخاتها لا مالتي.
حرايت صبو أما بزي تمكروخي بزي فلوز حلف كيو مرير زخانة جزيات بزح فليت بزح حبلنان أنا نستدرابيتين مو من الاختطاط الله حدران نبلون هزبنا الله يلكمو انتين كابزا أخيبا وتي سبسي انتاي كحسب الله انتاي كجبر الله تبليه.
إيشي بزحنا تماهرنا زي بزح تماهرنا عندنا أبحمشته نجار كقبلن حدا بزح تزاربنا نايتي health praxi نجد النسو كل وانا الله أم كوينا تدرابنا تحزي كونا نحواتنا تحزي كونا أنا كمان كل وانا الله COVID-19 تحزي كونا سي زخونا حمام كمان نجد النسو يدلي كم زي دكتور شوي تحت هنا تتزاربا كلايكا نجدن إذا كم زي حد تزاربوا اتيوم أب hospital دسارحو patient advocate دبحالو بحكايم تحزي كونو تنرس تحزي كونو جنزام سبات كم يجرون كم زي حجو زخا السخاء مفلات نجدن ساعتهم نبحك powerful تزلون اتي السود تحزي كونها إذا patient advocate نايك أنقع اللي هزاربا سب إنجليش ديك الكوينو ولا تي praxi كمان اللي هاد ديك الكوينو تبو إنجليش interpret the government comes al kakhalai bubu isu sa as an patient advocate kagabran kakhala malati ti religion and hira laka khoina ta amen and hirkom ka spirituality kha and hirkom kha au kha bisrat bubu kha laka just ana bahaki is very important it has some say ta nay geden ti medical record access تتركب كم دلك au تحف دولو السنة بحكي حق زناي معنا كله خاطر نجار نتاع كم زجبار كم زنبارة كله السوق بقى تردينا بدأ راح زي كنا خا السنة حسكا كم دلايكا question كتحت تغيرها تي محتاج راح زي كنا خا خد كخت كتتصنع تغيرها كتحت تغيرها كان نحب الساعة زي مشكا الساعة برتأتيها بعته خا نتي نحنا تسد دحجزنا زلو إذا زجبر زلو حج خمزي إذا نحواتنا دحجزنا زلو ناي جدًا أدلاي especially حجي أبزي ريج كنكبر لنا هلا السب كحجزنا كنزارب لنا إتا لاسلي خا إتناي إذا خات زاربنا إنا بزح إتي نايتي hospital policy ناي جدًا كنفوت لنا إتي policy نايتي hospital وشي guidelines زبنا معنا وسوق إتي power معنا زبنا بت policy اللي هرحيسكا كم تدبلنايو treatment راح زي كونه حق يتوبو تسب كم يجرو جبوه خمس جبارلو خون الله إذا policy خا بأصل زخونت حدا بنا COVID-19 سلنزارة دلنا حجي to visitation حجي سلا جبو سلا كنكين سلا زي كأننا بزماي زي حمام بزوم جيركا schedule زوم جيركا نا جدا نسبكا ختزارة نا جدا نسوف schedule جيروما حجي نحنا ندينا كل شيء ما نزارب علينا نسمع علينا موسيقى نسمع علينا مش كل مش دقيقة تزارب يعني را هجي الساعة تا policies لازم فلتنا الساعة جيرو هجي الساعة نقدن كمل كاتي policy مش فلتك إذا تجوبوكها خد حتى تدخل لاش لقاء ده يخبر دلي نتسب نحنا سبنا نحنا statistic أكونا مالت إذا COVID-19 كان بيأخذ لنا حجي أبتي نيوز كان بيأخذ لنا ولا social media كان بيأخذ لنا شح حساب مويتو كنت شح حساب مويتو number يزلنا حجي جن سبناها كم سبنا خون الله إتهم حكايم كخم سبنا خم خونو خاتم حكايم كفوت الله كم مسكونة بشمون حساب كتزاربولو جميلكا إتنجا قرب غياري هو كل نجا عملاق زبالي جن التساب جنا كم جبو خجبارلو لا إن حجبارلو خينها كم نستخدم كم جبوها نساب نساب بنمبر زي كونه بالشمو ساب كم مهانة نجدا نسها كم كم كستايمون إنكير كهم براكسو كونها كجبر تخيلها
ويذكرني شعوت جزيات تي كتاتوي مسافقة دلكي حدا بالشما شما دخن كله قال 5 فولت و5 جبركي كلايكا حلف حالفكي تي تتفوتوز نبرت موسيقاتات قال مسمعت راح زي كونه سئلي كمان او 5 قدفكي اجي او 5 زبلكيو اتي سبنا نا خريو خلوسي ادي عباي قال مخانا امو هيمانايز غيركيو مالتي سو السوق عابي ترات صايتمو اتي خمو مغباركس ناي بحقي بتاع من تايز بها عابي تمرتيو نخلو يغني لنا يغني لنا امو حجي انت هذا خاب حتوتات زمصي انتايو بزعبه ختابتي زي فاكسينيشن نسيو تسفا نسون تمصيو طرحيو هو نز نغرات كزحل زخل يالله موتي تحتو نابخي دكتور حنا كما يزلو مصنعتات بزح يغبر كم زلو نسمع مو حجي قال لي امو داتا ورحي امو داتا عمديو عمتا ديو او تات قال لهم حصر ابيلك قدا على لنا
اتي فاكسينيشن كبحال كلو انتي الكات تغبر نتي حمامسي كم زي اللي بقى زقبر مالتيو فاكسين كبحال كلو كتبات كبحال كلو كم دقن حجي خالوت حمامات كم تطفأ زقبرن كا هم بحق زي كتبات بهلاويو ازي كتبات حواب ناي منشمو ناي كوفيد 19 غانا ابتي ناتو ابتي مجمرا غزي يزلو كل سب انت اشمو بلانو مخنياتو ازي بحقي حما تبارع على الحمام سزخونه اتي فوسخ يكونه اتي حزبي سوشيال ديستانسينغ زبحال يغبرني ولاتي يدخمك كمان سلچوكا معسي ناس غاب معسي انت اشمو ايسوليت كنا نبر كتبل هذا اللاسي نزي حمام كتكالخل فاكسين بهالامو ترى اخا 2011 I mean 2021 ويغلت يزبحال زلو سلازي سي فاكسين سغاب زمص ግን بتخالنا متن تازلنا خنقبر زلنا سي ماسك غيرنا سوشيال ديستانسينغ غيرنا كنكنا خن كم زلنا ازي اتا فاكسين بزاوان زي زلا تخال فاكسين ግን كمصخلو عالم كل إزدالي زلو سلازي نابئيو تي رخوب دي خرخبو تي دخاخ خرخبو ديو بزح نقرات هالو انتاش مكونسيدر زقبر زلو سلازي يسرح هالو منسيو ناقدنيو جن بز وان زي حجي كونن لأنا بعمد كاب حجي خون وش دي تروح خاب حجي خون سقاب كشعوخه إذن كلن هاجرات إذن كلن ستيتس تبارع عن زلوا حجي ناي سوشيال ديستانسين ناي انتاش مو ماسك زي مكلخا زي مقبال إسا أزا فاكسين زلا بز وان زي
alright صبو سلازي سقع اوتات نبتصح سي ابتم كل خلا وخنا دهب علنا قليل كلمه ماسكن اذا سوشيال ديستانس ما فللي هو مونغو ساعات قال مغبار نيرا اجي فقات انت دا خوينو ابتطاخن ماسك قال له كندو ماسك خن قداو انت دالو هو ما باب حدا كم غيركا خمس جبر اسكي بدكتور هانا اسكي خنجمر كم يوتي غبو اطاقما ناي ماسك كم يخي اسكارينا
اسكي حجي ازي حيزه زلخو N95 زبحاليو از بروفيشنال ناي ايربورن ديزيز كم زبعل تي بي وز حج خمسه خازي ناي كوفيد كاز جبر زلو ازي ما نمسب سئلو خغورو يخلنيو فيتينغ زبحالالو بسرعه تخد جركا كيميكال اللو زنفحل كتاشبخ أنا كايبلون تي أير سكوت يبلون حجسي تي سايز مسفارتك ميديوم ديو لارج ديو كل جزء عخات تجبر إذا فيت كتجبرك تيست كتجبرك تجبره قريت خليها مخنياتو ولا حنت بروتكشن يبلون لكعو تي دلاو مالتيو تي بروتكشن إذا خا زخونه سبخ قبروسي ندعي كاب متن لعلي داش مسلني ازي زقبار ابيو اب هوسبيتال وشتي بس يسرحوا مس هاي ريسك بيشنتس تسرحوا سبات مس حمام زسرحوا سبات يمن زقبروا ازي زلنا خا
نوا
ناي تركيو
نوا
دربيو
صبو ابي جديد
صبو ابي جديد هو حد ازي خمسه غيرنا اب اذننا كم زاجرنا خندورو لنا بسرعه ازي اب تحت خيدو كم زخون الله أبدأ عند حركينا قال لي أنكم زجار مخلو
ايوه
أزي جايو مخنياتو تتنفس على خانة بفنجة تي نفاس تنفاسي بفنج بأفتر رايكونه بفنجان تي فيروس كويس أساسخل كن عكس ولا لنا خمسة جيرنا كم زجار كهاي كيدني تي كذكره خلي خاطرين لعلم كبار بتخيل متن تهي وزلات الناس زي بس وانا زي تختبر خمس خد فاكسين زلو ماسكن سوشيال ديستانسينج سلازي نزسنا قدام كنقبرها لنا
alright دكتور آدم
أنا كمان كمان لك إذا لاني تكلاد ماسك إذا لاني صح لو كم تداك هنا زبلته كوا فنشات بيلوس قاعنا عف كافر زقباري
alright صبو دكتور شويت فليز بلالو كديو على
نا بس حقات فليتي كونتن قل سيرجيكال ماسك تبهاليا اب هوسبيتال مستي كوفيد-19 زلو سبزي تقرب تخوينكا اب كالو بوتات السرح بتوستات تخوينكا ازي تقبرو مالتيو and اوكي 100% ايكونن كمزي دكتور هانا زبلتو تايت ايكونن ليك قبر خلي بزي but at least بزي انت تايت جيركايا كالا خلالكا خلي مالتيو كمزي زبلتو زي ايت فقدنيا انزي ايت فقدنيا so انت زي اس مغبارسي غروسوري كيد كلا خاديو ولا ابكال بوتا كيد كلا خازي ام مغبارسي كالسي ترغمي بلا مكل خلنا عخات رح so
alright صبو أبا خلهم بار دكتور شويت بناي انتي خان نسمع بناي عدنا لويت ديو وينكا نتألا غابي هو سوتاتي شفنا لكا زبلا بهالا لمو كمي تريو كمي خسر رح يخل
اتي ريكومنديشن انتايو نتألا سيرقا يانو
ايوه
ግን حجناي كاراتيرا كوتن مشالو نسا اوشتي اما اخل جيركا بقدميتن بدحريتن سينتاتيك زخونه فابريك تطقيمكا انت ساريحكايا ناي مكل خال عقما صبو تخون مالتي نصلا ግን رقاقيا تا نصلا خنغبرا خلنا خاني نصلا تدمص صبو نيرو كم زغير كاخت ونزفا خلا قاسي كتورد يا تدي با اخ تورد يا تدي با اخ
ايوه
كليسب غابي خيبل تا غابي صدقتي اب ماسك عينت شيب جيركا ساريحكا بزي ام قرقريتا بزني تغيركا لا بقدميتن بدحريتن كاني كوتوني نو بقدميتن بدحريتن كاسينتيك تغيركا لا you know I think it's دحاني قلنا نصلا طرحسي رقاقه نو
منديلك
يا منديل حجي كم يبهال زع عصيفكا ግን ክትኣስሮ ኣለካ ንኸይወርድ እኮ ይሕጅ ዘሎ ዘለዋት እታ ባንዳና ገለ ዝበሃል ምሽ ኮሚዝ ዝግበር some extent ሲ prevent ይገብር እዩ ከምታ ዓንተ ወይ ዝበልኩ እዩ ገለ ባሪየር ክትገብር ከለኻ ኣብሲ ክትሓጥሽ ክትብል ከለኻ ድዩ ወላቲ ክትስዕል ከለኻ ድዩ ክትዛረብ ከለኻ ድዩ ቲ ዲስታንስ ተጉድሎ ኣለኻ ማለት እዩ ምስ ኣኻታ 6 ፊት ከኣኒ ዲስታንሲንግ አንተ ወስኽካላ እሱ ይዘለና መከላኸሊ ካልወል ሓንቲ ትገብር ኣይትኽእልን ኢኻ
alright ጽቡቕ ናብ ሕቶታት ክንቅጽል ናይ ቫክሲን ጽቡቕ ድሓን ድሕሪ 6 ወርሒ ድሕሪ ዓመት ገለ ክመጽእ ይበሃል ኣሎ ድሓን ንጽበይ ግን ሓንቲ ነገር ከም ሕቶ መጽያ ዘላ ሓደ ቤተሰበይ በዚ ቫይረስ ተጠቂዑ ሓዊዩ ኣብ ገዛ ኮይኑ ሓዊዩ ድሕሪኡ ኣብ ውሽጢ 3 ወርሒ መርመራታት ምስ ገበረ እቲ መከላኸሊ ባህርያዊ መከላኸሊ ናይ ሰውነትና ዘሎ አንቲባዲስ ንሱ ዜሮ ኮይኑ ጸኒሑ እሞ ሕጂ ከምኡ እንተደኣ ኮይኑ ሲ እሞ ከዓ እቲ ቫይረስ እቲ ቫክሲን ከዓ ንዕኡ ስለ ዝመስል ከመይ ንጽበዮ እንታይ ርእይቶ ኣለኩም ዶክተር ሃና
لازم جزء زوسد زلوا مصنع تخبر الفاكسين متاع شو تفطر مخنياتو بزح زين يفلطوا نجار سلازلو ولك حمام نبين بحر سلازلو كسرح دي الفاكسين خلطوا واحد يخص أنح شديش واحد يخص أنح ولا عمل جه جبر مخنياتو جل الفاكسين على بكل تعمد كدق مزلكا دي تزار كل خاناي تايفويد حجي قاليو بافter وسيد كايو 4 عامات 5 عامات صنح نحن توجي هاي غلط عامات قبل عامات وتدخل لك من هتا يسرحني ስለዚህ እዛት ኩሉ ኣብ መጽናዕቲ ተዘሎ እዚ ክንብል ኣይንኽእልና በዚ እዋን እዚ
alright ጽቡቕ بسوشيال ميديا بزح جوجوي حبريتات ميس انفورميشن علمو نزي بخمي تقالسو انتي تجبري حيش كلاي مسات حيزه حتى زلخا نهزبي كمي غيركات مهرو ازي خونتات ازي سي معرخ ندي كبد مخانو تعالو بزياده خجبر زكال دكتور شويت
go ahead sir.
اوكي نت هزبي خمي كاخت مرات خير حنتي صبغتي ابنت انا قبل زلنا حجسي نهنا سب زخونت اديام دكتور اديام نهلت حجي كابتناتا اكسبيرينس يتزارب زلا نختقانن ወይ ከአኒ ንኻልእ ኣቴንሽን ኣይኮነን ኣነ በዚ መንገዲ ዝኸይድ ኣለኹ ካልእ ሰብ ግን ብኡ ንኸይከይድሲ እንታይ ክመሃር ኣለዎ በዚ ኣያ ትጅምር ማለት እዩ ካልኣይ ከዓኒ እዚ ናይ ሲዲሲ ዌብሳይት ኣሎ ናይ WHO ዌብሳይት ኣሎ ናይ ሓደ ሆስፒታላት ቤተሰብኩም ኣብቲ ሆስፒታል ዝኣተውዎ ናቱ ዌብሳይት ኣሎ ኣብኡ ክሬዲብል ዝኾነ ሓበሬታታት ክትረክብ ትኽእል ኢኻ
ኣራይ ዶክተር ኣድያም እንታይ ኣሎ ብወገንኪ تبليو توصلوا بزعبازي
إيشتي حالة بعلها كمان research كتكبر مالت إتي خمتي دكتور شوي تبلته إزي information أن إحنا كمان نقبل لنا to research أو خيط كاب علها research كتكبر كتحدد كاب علها question كتحدد نجد النسخة بعلها انفار كتكبر على كذا نجد نايزبلا زوجي كونسي ناي بعلها ترديها question لحدتك كأخذ كبر على كسب عنا research كأخذ كبر علينا
alright صبو دكتور هنا قالك توصل حاسب كنيركي
هو إذا انتي قالوا إذا حمام زي فتينا سألينا ريليو أنا حكيو مخنياتو رأي وزخون دي خاشحات حزب موتالو انتي إذا هوكس مالت إذا انتي قالوا بوليتيكا تموركي سومز قبل وزلو بوليتيكا خابت بريزيدنت جميركا ميس انفورميشن جمس زلو تلعلى امبري نريهم دلنا بيتسب حتاتو زي موتو سبيلن نيو سايت ريون لكم كندي سب موتالو بعد زي statistics كتر خلها بعالم كندمتاي ماتيو بحال كلوسي اذا كو سابيو سلكا عصري كونن حجسي اذا حمامسي برقص حماميو سلازي اندحر اتيو باهريو خا بقنطف زود سبي بحلف خا نحنا ولا إرترابان نكون ولا قلة يكون عليتنا تسلم هزبيو اتمنى عبيرنا اتي مبزحتنا كلنا as immigrant مبزحتي up inner city is قمت ات high risk بوسع تبع هلا قمت سلازسي اب ازيتات ندار انا اتخمزي ولا تمسلمت تموتوا نحنا مكن تسلمتينا بدن بس حلنا شكرا لنا high riskنا سلازسي كابزي نريو زلنا زستحكح داش مر رأسيسي كما يقرنا نزي حمام داوت خنقبو كما يقرنا حمام ايكونن كنبلو انا نعيب عمي يجنسوني يقرمني سلازيسي هوك سايكونن قلت لكم رأيو زي تنكف سريلن ولا تجازوت دي ولا زمد ولا زخونه سلازي نايب حقي كندي قصر خوبن بسكياتن بموتن ناتيلنا بمكتبين متعشمو خنا مرح لنا.
alright دكتور شويت تحت نعاخ بزعبا فيتامين سي نتي بحرياو مكل خالنا يسونتنا نز فيروس خاتقع بزيادة خنوصدو زلونا مدهاني تالو ديو نابنت قلنا حضور حمام اللونا امو كنقبرو نخل نقرات انتالو
اوكي سو بفيتامين سي اللي تجمرت حتى سو فيتامين سي بمسرته نتيناي بحلفناي متنفاس شامبوكوتات ناي تي انتجريتيو تي صبو كوينو خمس قلقل نخجبر كاب انفكشن ديو الرجي ديو فورين ساب ماتيريال ديو نخ تراب نخجبر زحجزو حدا كفلناي اكلاتنا صبو مسرت زهبي سو فيتامين سي موساد اي جود اكاني طغما كاخ اليو اي جود اكاني فيتامين دي خاني حاجه حدا ريسيرش واتس يمنيروم فيتامين دي جودلت زلوم سباتسي كوفيد 19 كحزم كله مور تايد بال دخونه يصنعوا تحمام إذن تايو COVID-19 رح يكونن قدمون كم زعينة حبريتات وصيني ريو any kind of viral pneumonia دي bacteria pneumonia ديو انت ناي فيتامين دي deficiency ويكا حصرت علىك اتي حمام برتعي بلكا زبل تايد بالالو حجاب زنا هنا هوسبيتال فيتامين دي تشيك نقبرو انت حصرت علىو سبلمنت نقبرو من هبو مالتي مغاتو فيتامين دي كابتوم فات soluble دبهالو فيتامينات يو ناي ماي soluble علىو اب فات soluble فيتامينز علىو تم فات soluble دبهالو فيتامينز كعقارو خليهم اب نفسنا ببزح توسيدنا توكسيسيتي خحزنا خلي سلازي فيتامين دي كم اتوم حدا እዩ መጠኑ እንተ ጎዲሉ ኮይኑ ቫይታሚን ዲ ጽቡቕ ትወስድ መጠኑ ዘይ ማዕረ ኣብ ጽቡቕ ቦታ እንተሃልዩ ግን ደውስድ መንገዲ የብልካን ማለት እዩ ካለ ብሓፈሻው እንታይ እኽብል ዝደለ ኣነ እቲ ጽቡቕ ዓይነት ኣመጋግባ እንተ ተመጊብና ስፖርት ንሰርሕ ተኮይና ብዙ ሓደሲ 30 ደቂቃ ንወክ ንገብር ተኮይና 3-4 ግዜ ኣብ ሰሙን እቲ ዘለውና ሕዱር ሕማማት ጽቡቕ ጌርና ኮንትሮል ክንገብሮም ፈውስና ብስርዓት ንወስድ ተኮይና ባዕልና ንባዕልና ሲ ሓላፍነት ወሲድና ሲ እዚኣ ነገር እዚኣ ጽቡቕቲ ኮነትን ክዛረበ ይን ሓኪመይ ባዕልኻ ኢንቻርጅ ክትከውን ከለኻ እዩ ትዋና ነገር ሰፕሊመንት ሓደ ክሕግዙ ክእሉ እዮም ግን ጽቡቕ ጌርካ ትበልዕ እንተኮይንካ ባላንስ ዝኾነ ዳይት ትበልዕ እንተኮይንካ ሲ ብዙሕ ከይድል ክእል እዩ
Alright, ጽቡቕ ዶክተር ሃና I think قرب تنكف كيونير كمثلا نزي أب زي تعادو ببزحي هو ناي مقدان ناي مماتن يرأي أما إزسي هو تنكف كيونير كيجن مريسكي انت رادق يمكننا تبونيرو نمنتاي انت خاخي قبرالو أبرئسي يوخا تحاحزاب بيلا انت يخص الله يدلي سب ناب حكمنا ناب هوسبيتال دي ولا ناب ቦታታት ናይ ሓኻይም ገለ ኸይድካ ከም ናይ ቀደምካት ምክትታል ሕክምና ጎዲሉ ኣሎ እሞ እዚ ከመይ ትርእዮ
هو እቲ በዚ ኮቪድ ምክንያት ኣይትምፁ ሓኻይም ኣይንሪአኩምና ኩሉ ተዓፃፂ ነይሩ ብዳስ ብቴሌፎን ሕክምና ዝቕፅሉ ብዙሓት ነይሮም ዋላ ንሕና እውን ከማን ሕጂ ግን ከከም ቦትኡ እንድዩ በዓል ማሳቹሴት እቲ ናይ ኮቪድ ዳርጋ 1.9% ጥራይ ዘለና ስለዚ እቲ ክሊኒካት ንኸፍት ኣለና ሕሙማት ከም ዝመፁ ምክንያቱ መብዛሕትኦም ደም ብዝሒ ዘለዎም ሽኮር ዘለዎም 3 ወርሒ ሙሉእ ህዝቢ ምስተዓፅበ ኣብ ክንደይ ፀገም ዝኣተው ኣለዉ ኣይከይድኒ ኮቪድ ክሒዘኒ ኢሎም ከዓ ብናይ ልቢ ድኻም ድዩ ብገለ ከዓ ክንደይ ከዓ ዝመቱ ኣለዉ ሕጂ ንዕኡ ነቶም انت اشمو نتوم هاي ريسك الو زبلهم عبيتي كاب 65 لعلي قال زبلو بعلها ناندا دولنا انا كمل لكم تمسو تخول لكم بزوان زي جن اب كاليف اب لوس انجلس تخون كاغنا تريو منها ولا اب على الحجي تي اب بزح تبارع زورو بوتا على اريزونا دي ولا قال كم كتم ايو مسيم كريوم اتي خال ابسالي مير ايديو ايرنك بحال كلو مبزحتيو اب ماينورتيز وايب سلم تبحالو المغنيات environment يو مالتي مبزحتيو سب اب كتما زنبر انت اشو ملتي فاميلي بحال ملتي جنريشن بحال اب حقوتات حوبتات يحوات دقوم ولا عبت يخون كل سبسب حنتين اشتي غزا بزح سب حنسا يقمط እዚ ሕማም ከዓ ተላጋባይ ብጣዕሚ ስለዝኾነ መብዛሕትኡ ሰብ ከዓ እዞም ለካ ዘለኹም ማይኖሪቲስ ወካ ፀለምቲ ኣብ essential workers እዮም መብዛሕትኦም ብሕልፊ ናይ ኒውዮርክ እንድሕሪእና ብባቡሮም ኩሎም ዝኸዱ ኣብ ናይ ስራሕ ዝኾነ ሆስፒታላት እዩ ገለ እዩ ነርሲንግ ሆም ብሕልፊ ወላ ኤርትራውያን ይኹኑ ሓበሻ ይኹኑ ወላ ደቂ ኣፍሪቃ ሕጂስ መብዛሕትኦም ኣብዚ ናይ ግሩፕ ሆም ነርሲንግ ሆም ገለመለ ብዙሕ ሰብ ይሰርሕ እዩ ሕጂ እቲ ሪስክ ሲ ብዙሕ ኣሎ እቲ ስራሕን እቲ ኢንቫይሮንመንት እዩ ኣጥቂዕና ዘሎ ግን እቲ ሕማም ምስ ሓዘካ ከዓ እቲ መብዛሕትኡ ኣብ ፀለምትን ኣብ ማይኖሪቲን ዘሎ ሕማማት ከም ሽኮር ከም ደም ብዝሒ ናይ ልብ ሕማም ገለመለ ስለ ዘሎ እቲ ዝነበረ ሕማም ኮቪድ ክሕዘካ ከሎ ዝገረደ እቲ ውፅኢቱ ዝመረረ ኮይኑ ግን ሲ እቲ ናይ ለበዳ ናይ ኮቪድ ግን እቲ ኣነባብራ እዩ ጻዕዱ መብዛሕትኦም ገዛ ኣለዎም በዚ እዋን እዚ ሕጂ መብዛሕትኦም ኣብ ሳመር ሆምስ እዮም ዘለዉ የለውን ኣብ ከተማ ውሽጢ تخال سبقن ولا حنمك والشبان دي زبهال ايسوليت كون كاتب الكايو ابكلتا بيدرومش ابي كون مم ايسوليت خغبرو حجي ازيو تتححزو اب صلمتن اب ماينوريتي اب اميغرانتن بزيحو زلو نا ايكونومي غدا لو نا كل سب خونه بتخالنا متن بتي انت اشمو حجي اب كاكا ابانا بحنستي انت اشمو تي كوفيد تعم هاي كلو اتستيت هوتيلات تخاريو نزوم كاب جزኦም ቦታ ዘይብሎም ወይ ከዓ ኹብሸው ዘይኽእሉ ተኾይኖም ኣብ እዮም ዘቕምጥዎም ነሮም ካብ ስድራት ፈልዮም ስለዚ በዚ ታቲኹም እዩ ማለት ኣብቲ ህዝብና ዝርአ ዘሎ ኣብ ጸሊም ህዝብን ኣብቲ ማይኖሪቲን ዝርአ ዘሎ እዚ
ጽቡቕ ይቐኒልና እንኳዕ ንሳ ደጋግም ክነበርክያ ንሕና ካብ ንሕና ጸለምቲና እቲ ከም ረይስ መጠን ምስ ኩሎም መስቶም ዘይፀዓዱ ምስኦም እቲ ሪስክ ዘሎናትና ካብናቶም ወልሓንቲ ዘፍልየና ወልሓንቲ የለን ጽቡቕ ሓራይ እሞ ዳርጋ ኣብ መወዳእና ዝመደብና ገለን በፅሕ ኣለና እሞ ብወገንክን ከክልተ ዳቂቕ ክበክን እየ እሞ ናይ መወዳእታ ለበዋ ወይ ከዓ መተሓሳሰቢ እንትህባ ተመሓላልፍኦ ትደልያ መልእኽታት እንታይ ኣሎ መንክን ክትጅምር ትደሊ
ኦኬ ኣነ ክጅምር ይበል መጀመሪያ ነገር ከም ሕሙም መጠን መሰልካ ምፍላጥ ኩሉ ጽቡቕ እዩ እንታይ መሰል ኣለኒ ኣነ ከም ሕሙም ክትብል ክትገል ኣለካ ድላይካ ክትሓትት ትኽእል ኢኻ ብዛዕባ ሕማምካ ተደሊኻ እቲ ሓኪም ዝበለካ ትገብሮን ዘይትገብሮ ናትካ ሓላፍነት እዩ ከምቲ ዝበለቶ ዶክተር ኣድያም ሜዲካል ሬከርድ ናትካ ናይ እዋን ናትካ ትውኖ ክትሓትት ትኽእል ኢኻ እቲ ኣቐዲምካ ዝግበር ናይ ሕክምና መምርሒ እዚኣ እቶም ንፈልጦ ዝነበርና ጽቡቕ እቶም ንፈልጦ ዝነበርና ንዘራረበላ and action ንውሰድ እዚ ኩሉ ክንዛረቦ ዝወዓልናሎ መዓንቲ ብኮቪድ ስለ ዝተዛረብና እምበር ወላ ናይ ካልእ ሕማማት እውን ዝትንክፍ እዩ እዚ ኩሉ ንዛረቦ ነበርና ان حنت ነገር ከዓ ክብል ዝደሊ ሓደ ሰብ ኣብ ሆስፒታል እንተ ኣትዩ እቲ ኮሚኒኬሽን ምስቲ ሓኪምሲ ከምዚ ዶክተር ኣድያም ትገብሮ ዝነበረት ኣብቲ ጽንዓት ዘለዎ ግዜ ክህሉ ኮኖ ጸኒዓ ትቐርብ ግን ምስ ክብሩ እያ ትዛረብ ነይራ እምበር ምፅእ ኢላ ሄይ ስኻና ባይ ክትፍትኑ ንስኻትኩም ከምዚ ገይርኩም ምን ገለመለ ኣይኮነን ትብል ነይራ ሕጂ እንታይ እዩ ኣብቲ መንጎ ሕሙምን ወናይቲ ሕሙም ቤተሰብን ኣብቲ ሓኪምን ምክብባር ተሎ ምስምማዕ መፅእ ማለት እዩ እንተ ተሰማሚዕኻ ከኣኒ ክትረዳእ ትኽእል ኢኻ ተረዳዲኻ ምስ ወዳእኻ እንታይ መፅእ ኣብቲ ድሕሪ ምርድዳእ ምትእማን መፅእ ማለት እዩ እንተ ተኣማሚንካ ኣብ መጨረሻ እቲ ናይ ኩሉ ወላ እቲ ቤተሰብ ድዩ ወላ እቲ ሓኪም ድዩ ሓንቲ ነገር እያ ዓላማ እታ ዓላማ እንታይ እያ ነቲ ሕሙምሲ ከመይ ጌርና ዝበለፀ ሕክምና ክንህቦ ንኽእል እያ ተዘረባ በቃ ካልወላ ሓንቲ ዓይነት ነገር የለን ስለዚ ኣድቮኬት ንኹን ቤተሰብና ግን ንብነፍስና ከዓ ጽቡቕ ጌርና ኢንፎርም ንኹን ሓበሬታ ብዙሕ ንድለ ሶ ዳት ብዙሕ እኽትኽን ንኽንሓትትን ንኽንፈልጥን የቐኒየለይ
ኣራይ ጽቡቕ ዶክተር ሃና መስታ ክትብልያ ሓሲብክ ዘለኸ ሓንቲ ኻ ክውስኸልክ እያ መወዳእታ ሕቶ ዝመፀት ኣላ ንሳኻ እንታይ ትብል ኣብ ህዝብና ብዙሕ እንታይ ዝበሃል ይረአ ኣብ ገሊኡ ስድራ ቤታት low white blood cells ይረአ ሕጂ እዚ COVID-19 ተራ ተጠቂዖም እንታይ ኣሎ እዚስ ኣብ ኮንሲደሬሽን ይኣቱ ዶ
እዚኣ እንታይ እሽሙ እዛ very interesting question እዛ ናይ እዛ low white cells መብዛሕትኡ ግዜ ንሪኦ ኢና ኣብ ናይ ሕክምና ኣብ ኣፍሪቃውያን white cells low እዩ መብዛሕትኡ ግዜ okay እዚ ዝኾነ ዓይነት hereditary ወይ genetics ክኸውን ኣሎ ምክንያቱ ክንደይ ሳዕ ሰይድና ኢና ናብ hematology ወላ ናይ ደም specialist ወላ ሓንቲ ዝፈልጥዎ ነገር የለን ግን ከምዚ ገምጋም ዝሪእዎ ዘለዎ መብዛሕትኡ ሰብ ካብ ኣፍሪቃ ገለ ዝመፀሲ white cells low ኣለዎ እቲ ዋላ low ይኹን እምበረይ dangerously low ኣይኮነን ኣሎ መጠናት እንታሽሙ ዝኸውን ሕጂ ምሳሌ ሓደ ሰብ እንድሕር ዳ ኪሞቴራፒ ኸይዱ እቲ ኪሞቴራፒ ነቲ ጻዕዳ ሴል ድዩ ወላ ንኹሉ ዝገብሮ ኣፀቢቑ ስለዝትሕት ኣብ ጠንቂ ስለዝበፅሕ نكتاتلو نعقو ويك أفوسات على وزقبا لكن overall كله أنت أشمو كأنك أنا يبلون
مفلاطو جين صبغينا أولا أو حنسا بزناي بحلف بزناي نا أفريقيا زلو رئيس قال ملا مصنعات تسلا زي تجبره أو نعوتات كم جيجا جيروم سلازستي أتحمم يكون ولا تتبع أنا يتحمم كنجر على الوزز بالكيو
هو مجمر عنده حارس بس بحلف أفريقيا طول لهم HIV مشك زجبرو مهنياتو HIV خا نتنا عدا سيل تحت زجبرو
أيوة
قدمي HIV يكون ولا تزيب لهمون قالوا نريئنا
أيوة
تخيل خبلا دليل زلخون تايد قالوا كم زي دكتور شوي زبلته حكيم أيكونن عن حكيم زخوننا
أيوة
حكيم فرق ما قد حجزنا خل نحنا قل تفرقي خا نحنا إنا partnership مالتي كم زي وعلي غيرنا أنا نتنافسي أنت أحمامي أنت فوس وسرال له أنت خجبر لي خلي خمي جرح كنا خاني خلي إلنا بسر عندنا أشمو ده تختاتلنا تحكيم عبد أنت أشمو بعقمه حجزنا يخل مالتي يوم ندعي تحكيم هي بني فوسي زفتنا قريب الليل قومتها تايسرحني
alright صبو أمور داتا last but not least يبلو زم عدي عندي قاشانا حفتنا موقعا أبسنكر كناتات زخلو سعر كنا بيلكن أبزمسانا خف مبالكي دكتور عادي أمن ملو سدرابيتكن نمسكن ناي مور داتا خم ناي كبري قاشانا بعلقي انتاي مخرلو بعلقي أتصولنا زا أخيبانا
يعني الله يداك منقص أنا انتاي قبل كم زبالا زحواتي حقا السا خا تي بعلنا advocate كنقبر لنا ولا تحكاي ما هلو ولا تسيستم هلو نحنا كبونا نفلت لنا advocate كنقبر لنا جن أنا انتاي قبل حبشنا حبش تي حزبنا جقنا يو resilient يو إذا إذا حمام حماميو كلا حمام كمان كمتسيو جن كم سب نحنا نن سب نمهرنا ننفسنا نتمهرنا نحواتنا نبوتاتنا نديتاتنا نمهرنا إذا نجر كاف نحالفون نخلينا كنا نحنا أبعدنا كمان تبوك جيرم في زموز الله زي حمام أبزخ عدز لنا resource لنا خمسة كأننا جينا especially كم تتزاربنا لهم عنتي أبتنهنا community خأنا قادر سلازخي جلا تتأنجعنا تبهلنا تبوقي reach you سبينا communal people لنا جن الجينا إذا جزء تحل سلازخنا تتأنجعنا تنقبره أستوئلنا كن كلنا السوق كنرد لنا أنت كم تقبل زلنا سلمنتها وزي الساعة كتبت لكن تمت أرشاد بلا نحنا ريزيلينينا كم حبش كم حزبنا كما خا زي COVID-19 كم أجرنا خا نقال سان خلينا
يعني لنا متشم نقولنا نمسجن حنتي بوجني أخبلا زدلي إذا متشم زي ننورز لنا زمن كبد زي كال دمسل موقع معاشي تموداتو درجة زي فلت قناتات كوينو يسمعنا نراينا نالو جن أبناء تاريخ عالم أبناء حمامات انتدارينا بزح حمامات تحاليفي بزح سعر تغيرلو بقى كلنا خنطفينا خنلكمينا بزبللو زنبره غزي مصنعات سلاستغبرلو موهات مجمرتا نقندي نتي كغبرو زلو ابيت كادلو سخت كالاخللو تخل نغرات نسون تداغيرنا نزي صنكر كناتات حالفنا مدهانيت مصيو مدهانيت محكمي ديو ولاس مكالاخلي كمزمص طرطر يله سغعابو نبصح جين حده تي مكلخال خنكالاخلو خنغبرو زلنا عقل غيرنا خنغبرو خمزلنا زنحواتنا خمزبلو حذرا نبل كالا ايكا كل غزي حضور حمام يحلونا بزي قدس حبوء زخونه حمامات بقاعد دير له نسوخا ازناي سنا امراو مبصبات mental health ازي نابانا ناب حبرتسمنا ببزح يرى له ازي خا بفلاي فوليات سلازخونا يكونن كوم يو زين خوناتات ازي ጭንከት ازي نخلو يتنكيفو زلو حادرا كمي غيركا ازي منገድ ازي ناي نوح سلازخونه كمي غيرنا بحبار مزن فوتوم ቤተሰብና ይኹን ኣዕሩኽትና ኣሕዋትናን እንዳተዛረብናን እቲ ጭንቀት ዝገብረልና ዘሎ ከመይ ጌርና ብሓባር ከም ንስዕሮ ምዝራብ ስለ ዘድሊ እዚ ናይ ውልቀ ሰብ ጉዳይ ዘይኮነ ናይ ሕብረተሰብ ስለ ዝኾነ ሓደራ በብእዋንና በብወገንና ነንሕድሕድና እንዳተሓጋገዝና ነዚ ሽግር እዚ ከም ንሰግሮ ጥርጥር የብልናን ስለዚ ኣጆኹም ብወገንና ከዓ ሓኻይም ይኹን ነርስታት ኩልና ተዳሊና ኣለና እቲ ክንገብሮ ንኽእል ብወገንና ድልዋት ስለ ዘለና ኣብ ዘድሊ ግዜ ሓገዝ እንተዳልይኩም ደውሉልና ወይ ከዓ ፅሓፉልና እዚ ይቐኒልና ብሰላም የራኽበና ሰላም ከኒ
Thank you.